नमस्कार, गुड मॉर्निंग। 4 दिन पहले यानी 8 जून को वर्ल्ड ट्यूमर डे के रूप में मनाया गया और उस दिन दुनिया भर में कार्यक्रम आयोजित किए गए। इसका मकसद था लोगों को इस खतरनाक बीमारी के प्रति जागरूक करना। आज हमने यही पहले यानी 8 ने लोकप्रिय ऑनलाइन शो हेल्थ फॉर ऑल के माध्यम से मामूली सिरदर्द से शुरू इस जानलेवा बीमारी के बारे में लोग बहुत कम जानते हैं, इसलिए उनकी अज्ञानता इस मर्ज को और बढ़ा देती है। लोगों को स्थिति की जानकारी तब मिलती है जब काफी देर हो चुकी होती है। आज हमने देश के जाने माने न्यूरोलॉजिस्ट और न्यूरोसर्जन्स को अपने शो में आमंत्रित किया है, जो हमारे और आपके मन में उठने वाले हर सवालों के जवाब देंगे। क्यों होता है ब्रेन ट्यूमर, क्या लक्षण है इसके, और सबसे बड़ा सवाल कि क्या इससे बचा जा सकता है, यानी इसका प्रिवेंशन है कोई, और अगर किसी को ब्रेन ट्यूमर हो गया तो क्या कंप्लीट क्योर संभव है। ऐसे सभी सवालों के जवाब आज हम डॉक्टरों के माध्यम से आप तक पहुंचाएंगे। आप हमारे साथ 3 घंटे तक जुड़े रहें। हमारा ये कार्यक्रम अगले 3 घंटे तक फेसबुक और यूट्यूब पर लाइव रहेगा। तो कार्यक्रम को आगे बढ़ाते हुए हम सबसे पहले देखते हैं आज का ये राउंड अप वीडियो। हील फाउंडेशन के ऑनलाइन लाइव शो हेल्थ फॉर ऑल में आप सबका स्वागत है। आज हम एक ऐसी बीमारी पर बात करेंगे जो है तो बहुत खतरनाक, लेकिन इसका नियंत्रण हमारे आपके हाथ में है। जी हाँ, हम डायबिटीज की बात कर रहे हैं। डायबिटीज घर घर पहुंच चुका है और अब तो ये कम उम्र में भी लोगों को पीड़ित कर रहा है। वजह है खराब लाइफस्टाइल और गलत खान पान। डायबिटीज खतरनाक इसलिए भी है क्योंकि ये शरीर के हर अंग को प्रभावित करता है, या कहें तो डैमेज करता है। इसके शिकार लोग एक साथ कई समस्याएं झेलते हैं। लोग जीवन भर दवा के सहारे जीने को मजबूर हैं। इंसुलिन और दवा पर निर्भर लोगों के मन में अक्सर ये सवाल उठता है कि आखिर कब तक दवा के सहारे जीना पड़ेगा। डायबिटीज के शिकार लोगों के इन्हीं सवालों को ध्यान में रखकर हमने आज का एपिसोड तैयार किया है।
We kickstart the first session with yoga, and the topic is yoga for diabetes.
So if we talk about diabetes, there is basically type 1 diabetes and type 2 diabetes. Type 1 diabetes is, as they ask, your genetic history, that whether in your family there is a history of, and a lot of young children are getting type 1 diabetes. There is less effect of yoga on type 1 diabetes, but there is so much more effect of yoga in type 2 diabetes. Because type 2 diabetes generally come, 1, because of stress, 2, because of erratic lifestyle. You're not sleeping on time, you're not getting up on time. See, a lot of people actually say that they sleep on weekends. They basically have very less sleep on weekdays, and weekends they'll be just lying down on the bed. Those kinds of lifestyle you cannot have. When you are supposed to sleep, you need to sleep. When you're supposed to get up, you need to get up. It's very important to have a 8-hour sleep in the night. So if your lifestyle is that you're working in the night and sleeping in the morning, all that affects. Start with Trikonasana or triangular pose. Your hip So knee is, your ankle is slightly apart from the hip. So this is hip length, slightly apart from the hip. The ankle facing slightly out. Okay. Breathe in. Take your hands up and breathe out and go all the way down. Breathe in. Take your hands up. Breathe out. Go all the way down. Now, when you're going down and you want to hold this pose, you can even hold it, but make sure that you don't hold your breath. So if you are here for 10 to 15 seconds or 30 seconds, you can just keep breathing 1, 2. Okay, so don't hold your breath ever. So that's Trikonasana, going on the right side and then going on the left side. Now, as I said, bring your leg together and go all the way back. Breathe in and breathe out. You come and try to touch your ground. If you are not able to touch the ground, you can even slightly bend your knee and try to touch the ground. Your abdominal cavity is completely in touch with your thighs. Okay? You can even try to hold your legs and try to bring your head.
और अब वक्त है योर हेल्थ काउंटर का, जिसका टॉपिक है ओरल हाइजीन बेस्ट प्रैक्टिसेस फॉर हेल्दी टीथ। इस विषय पर विस्तृत चर्चा के लिए हमारे साथ हैं डॉक्टर महेश चौहान। डॉक्टर चौहान ओरल इम्प्लांटोलॉजी, रेस्टोरेटिव डेंटिस्ट्री और एस्थेटिक डेंटिस्ट्री के अथॉरिटी माने जाते हैं। कई राष्ट्रीय और अंतर्राष्ट्रीय साइंटिफिक पब्लिकेशन उनके नाम है। वह एक लोकप्रिय पुस्तक के लेखक भी हैं, जिनका टाइटल है A Visual Guide to Fiber Reinforced Composite in Dentistry। मैं शंकर जी को से रिक्वेस्ट करूंगा कि वो उनसे विस्तृत बातचीत करें कि मिस्टर आर शंकर हील फाउंडेशन के प्रेसिडेंट हैं। मिस्टर शंकर का जर्नलिज्म में लगभग 3 दशक का अनुभव है। वे कर्नाटका और केरला से प्रकाशित न्यू इंडियन एक्सप्रेस के रेजिडेंट एडिटर रह चुके हैं। स्वास्थ्य विषयों पर उनकी खास रुचि है और वो इस पर पकड़ रखते हैं। अब तक हेल्थ राइटर्स के 200 वर्कशॉप और 7 नेशनल हेल्थ राइटर्स एंड एडिटर्स कन्वेंशन का आयोजन कर चुके हैं।
Modern technology has emerged such that, as you said, it's not a bad experience. It's a pleasant experience also. So there is no problem. So what are the technological leapfrogging that has been done in the field of dental care?
Before the technology, I would talk of the human factor, because fear is all about the mind. So it is definitely the progress has been made in terms of dental education for the dentist to be sensitive towards the towards the need of the patient on a psychological basis also. And talking of technology, the machine advancement and the material advancement has been tremendous since the decade of 50s. I would say really the drill and fill approach changed in the 50s and the 60s, and it has been going on progressing. So the machines with which, for example, the ultrasonics cleaner with which the teeth are cleaned, talking at the very basic for the oral hygiene, those have now very sensitive feedback mechanisms that it reacts according to the pressure that the dentist puts or is required for the teeth to be clean. So it automatically adjusts the vibrations and the pulses so that the patient feel pain. And the anesthetics are more refined, more choice of anesthetics are available. And overall, minimally invasive dentistry, there is a thing called minimally invasive dentistry. So that has been into much work these days, so that we don't have to cut more.
Tooth loss patterns are connected with cornea. How far is it true?
When a periodontal disease or separia gets unchecked, then the colony of the resident bacteria that develop there grows into something else. So it is like that. When the brush is not done properly for 24 hours, you may have a certain group of organisms in the mouth which may not be so harmful. But as it progresses, 48 hours, days, weeks, months, then what happens? It becomes very, very much a permanent resident in the mouth. So, and that if checked, not checked, like patient doesn't go every 6 months for checkup, or is fearful, or is avoiding dental treatment for some reason, then that becomes more and more, and then the plaques go on going in the blood system, and then patient typically may lose lower anterior teeth, lower front teeth, for which again I have devoted much time in writing in my book. And then they typically lose their first molars, from which 60% of chewing is being done. So really, all the parts in the body, all the organs are connected, and we really must take care. Life of animals even depends on teeth. If animal loses teeth, they lose life. It's almost like that.
We now enter session 3.
जैसा कि आज हमारा टॉपिक है डायबिटीज रिमिशन पे, ये सचमुच होता है या एक मिराज है? ये क्या है ये डायबिटिक रिमिशन?
देखिए, जो वर्ड है जिसको कहते हैं हम लोग रेमिशन, डायबिटीज रेमिशन, उसका मतलब ये होता है कि किसी व्यक्ति को जिसको डायबिटीज है, अगर उसकी वो 3 महीने की ब्लड शुगर 6.5 से नीचे रहे फॉर ए पीरियड ऑफ 6 मंथ, तब इसको हम लोग रेमिशन कहते हैं। कई लोग इसको कहते हैं रिवर्सल ऑफ डायबिटीज। तो रिवर्सल होती नहीं, बिकॉज डायबिटीज एक मेटाबॉलिक प्रोसेस है, वो जो है इट इज गोइंग ऑन प्रोसेस, थोड़े दिनों की हो जाएगी, मे बी जैसा कि हम लोग बात कर रहे हैं। रेमिशन का मतलब ये है कि कितने पीरियड के लिए ये कम होगी। एक अगर आप मुझे 2-3 मिनट दें तो मैं आपको बिल्कुल इसका जो समझाऊं कि बेसिक क्या है और क्यों इसके बारे में चर्चा हम लोग कर रहे हैं। जब हम कोई भी खाना खाते हैं, जो कार्बोहाइड्रेट, प्रोटीन या जो भी हम करते हैं, उससे हमारे शरीर में जाती है और उससे हमें ऊर्जा मिलती है और उसमें इंसुलिन का योगदान होता है। लेकिन यही अगर हम बैलेंस रहता है, हम खाना खाते हैं, हम रेगुलर एक्सरसाइज करते हैं, तो हमें ठीक रहता है। डायबिटीज का कारण क्या माना जाता है कि जब हम खाना बहुत खाते रहें, एक्सरसाइज ना करें, तो एक्स्ट्रा फैट या जिसको कहते हैं हम एक्टोपिक फैट, ये लिवर के ऊपर और पैंक्रियाज के ऊपर जमा होने लगती है, और इसके जमा होने से इंसुलिन की कार्य क्षमता कम होने लगती है, और उसकी वजह से इंसुलिन रेजिस्टेंस हो जाता है, ब्लड शुगर बढ़ने लगती है। हमारा मेन उद्देश्य क्या है रेमिशन में, कि यही जो 10 से 15 किलो वजन है, अगर हम इसको कम कर लें बाय मीन्स ऑफ एक्सरसाइज, बाय मीन्स ऑफ ए डाइट, बाय मीन्स ऑफ ए जो भी 2-3 तरीके हैं, तो हम इस रेमिशन को प्राप्त कर सकते हैं। क्योंकि हुआ क्या कि फैट डिपॉजिट हुई पैंक्रियाज में, तो बीटा सेल जहां से इंसुलिन बननी है उसने अपना काम कम कर दिया, तो इंसुलिन की कार्य क्षमता कम हो गई और इंसुलिन रेजिस्टेंस हो गया, ब्लड शुगर। लेकिन ये जरूरी नहीं है। 2-3 चीजें हमेशा याद कर लें कि हर किसी आदमी को रेमिशन नहीं हो सकता।
Can you tell us more about the diabetic prevention control project with National Health Mission, and which is supported by the World Diabetes Foundation Denmark? What exactly do you do?
Actually, sir, we have started in Uttar Pradesh a pilot project Kanpur with 57,000 pregnant women. Okay, so outcome around 16% of the pregnant women was detected with diabetes. So we call it the diabetes in pregnancy. We also call it GDM, gestational diabetes mellitus. So after that motivation from this pilot for Kanpur, the government expanded it into the 50 districts. So now in the Uttar Pradesh, every A&M has been given a glucometer and 75 gram of glucose, so that she can detect the diabetes during the pregnancy. Okay, and I would like to tell you, Mr. Shankar, this is the only guideline which is based on the DIPSI criteria. Okay, this is Make in India project, where the guideline is not from IDF or ADA or any foreign organization, but this is the guideline which has been made by Diabetes in Pregnancy Study Group in India and has been adopted by Government of India.
डॉक्टर साहब, मैंने कई लोगों में देखा है और पढ़ा भी है कि बहुत से लोग ऐसे हैं जो सुबह ब्रेकफास्ट से पहले जो फास्टिंग का टेस्ट कराते हैं वो ज्यादा होता है, और ब्रेकफास्ट के बाद वाला टेस्ट जो है वो उसमें लेवल कम आता है। ऐसा क्यों होता है? क्या ये नॉर्मल चीज है?
ऐसा अक्सर होता है कि लोग जो खाली पेट शुगर कराते हैं और जो खाने के 2 घंटे बाद, नाश्ते के 2 घंटे बाद शुगर कराते हैं, तो नाश्ते के बाद वाला शुगर या ग्लूकोज लोड के बाद वाला शुगर जो है वो कम आता है। इसकी कई सारी वजह हो सकती है। एक तो शुगर कितना बढ़ता है वो निर्भर करता है क्या चीज़ खाई। अब जब हम जब हम डायबिटीज के डायग्नोसिस के लिए टेस्ट करते हैं तो हम आमतौर पे कहते हैं कि 75 ग्राम ग्लूकोज लेने के 2 घंटे बाद शुगर टेस्ट करिए। अक्सर ये होता है कि लोग घर में अलग अलग चीजें खाते हैं, नाश्ता लोग अलग अलग करते हैं, तो शुगर कितनी बढ़ती है ये उस पर भी निर्भर करता है कि आपने क्या खाया है, उसमें कितना कार्बोहाइड्रेट कंटेंट है, किस प्रकार का कार्बोहाइड्रेट है, क्योंकि हर चीज खाने से शुगर एक जैसी नहीं बढ़ती। बेशक उसमें उतना ही कार्बोहाइड्रेट हो या उतनी ही कैलोरी हो, जिसमें फाइबर ज्यादा होता है, जिस चीज में फ्रूट फाइबर होता है, तो ऐसी चीजें खाने से शुगर धीरे धीरे बढ़ती है। तो जरूरी नहीं है कि उतनी मात्रा में आपने कैलोरी कार्बोहाइड्रेट कंपैरेटिव लिया तो आपकी शुगर उतनी ही बढ़ेगी, ज्यादा बढ़ेगी। तो ये एक तो निर्भर करता है कि क्या खाए। अगर चीज उसमें हाई फाइबर कंटेंट होगा या लो कार्बोहाइड्रेट कंटेंट होगा, जैसे खाली सब्जियां खाई होंगी, सलाद खाया होगा, तो शुगर धीरे धीरे बढ़ता है।
It is said that poor control of diabetes during pregnancy increases the chances of birth defects and other problems. It can also cause serious complications for women. What are the precautions to be taken, Dr. Anjali?
So diabetes in pregnancy comes in two contexts. One is a woman having diabetes prior to pregnancy and then she becomes pregnant, or there is something called as unmasking of mild impairment of carbohydrate metabolism, which will get precipitated by pregnancy. Now, this was typically called as gestational diabetes mellitus, or diabetes that is caused or brought in by pregnancy. Now, there are certain changes जो अपनी बॉडी में होते हैं जिसकी वजह से कार्बोहाइड्रेट इंटॉलरेंस हो जाती है या इंसुलिन रेजिस्टेंस हो जाता है, या जितना इंसुलिन प्रेगनेंसी के लिए बढ़ना जरूरी है उतना इंसुलिन नहीं बढ़ पाता है। तो इन केसेस में जेस्टेशनल डायबिटीज मेलाइटिस जिसको हम कहते हैं ये होता है। टिपिकली जेस्टेशनल डायबिटीज मेलाइटिस 24 वीक्स के बाद होता है। 20 से 24 वीक्स ऑफ जेस्टेशन के बाद टिपिकल प्रेगनेंसी इंड्यूस्ड डायबिटीज होता है।
We are now in another 3 or 4 months we are entering into a festive season, and then you have a lot of advertisements coming that if you are diabetes, don't worry, this is a sugar-free laddus, sugar-free jalebis, sugar-free this, sugar-free that. So how safe are artificial sweeteners?
It's not safe. I will suggest, this is my personal opinion. At the same time, research also says sugar-free, they have other side effects. It raises your blood sugar, though calorie wise they say that it's sugar free means you will not get calories. Okay, so calorie wise you can restrict your calorific intake by taking artificial sugars, but it raises your blood sugar level. At the same time, it causes lots of side effects. So it's better to avoid those sugar free sweets. It's my request to my government to ban such kind of advertisement of selling the sweets in name of sugar free for diabetic or for heart patient or for obese people, because in India there is no regulation to stop such kind of advertisement, but these are not good for anybody. It causes cancer also.
Welcome back. We now have the episode intro video. I request the admin to play the video. Namaskar and welcome. I am Shankar Raj, President of Health Foundation, and this is to remind you that this show is live on Facebook and YouTube. We commence the first session on yoga for mental health, and we have with us Ms. Swati Bharadwaj, who is a yoga expert with over 5 years experience. She specializes in therapy using yoga anatomy and prenatal and postnatal yoga. Over to you, Ms. Swati. Where are you from?
Hello, good morning. I'm from Bangalore.
Okay, fine, good.
Yes.
Good. Okay. So you have time till Bangalore has a very good weather. I was told by my co-moderator that Delhi is 42 and Bangalore is an OT weather. So you have time till about 8:55. Over to you. Yeah.
All right. Okay. Good morning, everyone. Very nice to meet all the panel members here. So I'm here to talk about yoga for mental health, right? So these days, the most common issue that most of us face in this fast-paced life is stress. And as we all know, stress is the root cause for most of the health issues that we all face these days, like diabetes, like hypertension, and many hormonal or lifestyle disorders that we all go through. And I think not just the physical or the physiological issues of stress also affects the mind in different things like depression, anxiety. That stress is the root cause for it. अगर life में कुछ गड़बड़ हो जाता है तो we all get stressed about it, and if we don't know how to deal with the stress, and if we are stressed for a prolonged period of time, that results in anxiety, depression, and having anxiety and depression for a longer period of time results in many other clinical mental health disorders. So what yoga does is, first, it works with the body to release any stiffness, tightness in the muscles, to moving into the systems, into the main organ systems in the body, and working with the organs by rejuvenating them. Thus, by reducing the symptoms of stress physically and physiologically. Also, it works very closely with the breath and with the mind by reducing the different symptoms of stress that affects our breath and our mind. All right. So, yes, let's look at the practice for today. Okay, so today's practice will be focusing on calming the mind. So we work first with asanas and pranayama, and if possible, a bit of a short meditation if time permits. So let's look at it that way. The focus of today's practice would be to calm the nervous system, as well as lengthening the breath. Okay, so that helps in reducing the effects of stress. Let's get on with the practice. For everyone who's watching, if you want to roll out a mat with me, go ahead, roll out a mat, and let's begin the practice for today. All right. Now sit in any comfortable posture. This is Vajrasana. You can also sit in a regular cross-legged posture, which is Sukhasana, whichever is comfortable for you today. Now keep your eyes closed. Start to observe your breath. Watch how you're breathing today. Place your right hand on your abdomen. Observe the different movements of your abdomen as you breathe. Remember not to force your breath in any way. You're breathing naturally and watching the natural breath. Now slowly open your eyes. Now we'll start with a nice restorative posture. Sit either with your knees together or knees apart, all right? Whichever it feels comfortable for you today. And slowly bend forward, drop your forehead down. Shashankasana or child's pose. You can stay in this posture for about 3 to 5 minutes. This is a wonderful posture to regulate your breath. This is an amazing posture to regulate the nervous system. Remember not to tighten your shoulder here. Keep your shoulders relaxed. And as you exhale, imagine that your body is sinking into the floor. Slowly inhale and come up. Now close your eyes and observe your breath. Doing this posture immediately changes the course of your breath. If you've had a stressful day, a stressful time, the breath becomes very short and shallow, right? And doing a posture like this opens up your breathing channels and pathways and increases the effectiveness of your breath, right? Now, come on all fours. Now, remember your knee is in line with the hip, your hands are in line with your shoulders. Now, inhale, lift hip, chest, and the head up, look up, curling your back. Exhale, round your back and push away from the floor. Inhale, exhale, inhale, exhale. Get in touch with each movement of your body. Observe how the lower back moves, how your mid back and the upper back move along with your neck as you breathe in and out. Five more rounds. Doing any movement in the body increases feel-good hormones like endorphins, serotonin. Any exercise would do that, right? So introducing even a little bit of movement would help our mental health to a great extent. Right? And slowly sit back, keep your eyes closed. Now let's release a little bit of tension around the neck and the shoulder, right? So whenever we are stressed without our knowledge, we tend to tighten our neck and shoulders this way. So as much as possible, we need to keep this relaxed. We carry a lot of stress around our shoulder. That's why whenever someone comes and gives a nice massage around here, we feel so good and so de-stressed, right? So let's see how we can reduce some tension around the neck and shoulder with some postures with yoga, right? Now, lift your right arm up. I'll be doing your mirror image. So I'll be doing the opposite side. Take your hand towards your ear. Stretch the left arm away from the body. Pull the head towards one side. Hold for 5 breaths. Observe the stretch around the sides of the neck. Inhale, exhale. Now, whenever you're holding a posture, remember not to hold your breath. It's very important to keep breathing in the posture. And 5. Release. Now, interlock your fingers. Take your hands behind the head. Now, rest your palms at the base of the skull, just above the neck. Okay? Just above the neck. Interlock your fingers. Now, you're pulling your head up. Pull it up and push it down. Elbows closer. You're pulling the head up with your arms and pushing it down. Now breathe into the stretch. Make sure you're not rounding your back here. You're sitting upright, straight, and you're only bending at the head. You can hold this posture for about 10 breaths. Observe that stretch around the neck that runs down all the way towards your upper back. Inhale and exhale. Right? Now, for the shoulder movement, bring your fingertips towards your shoulder and start to rotate. This loosens up a lot of muscles that are very much necessary for a good breath, right? So like the shoulders, like the intercostals here, it helps release any tension around. So inhale as you go up, exhale. Now reverse. All right, relax. All right, now stand up. We'll do a few standing postures now. I hope I'm visible. All right, now take your feet about a hip width apart. Hip width is the width of your hip bones, not the hip as such, just the bones. Right? Now, as you bend forward, push your hip back. It's okay to keep your knees bent. Lengthen your back. Lengthen your back and bend forward. Drop your hands down. Now here, even if you're not able to reach the floor, it's perfectly all right. You can bend your knees as much as you want and you can drop your hands down. Because what happens if I keep my knees straight and bend, right? I'll be rounding my back so much. It will tighten my chest, it will tighten my shoulder, and it will affect my breath, which we're not doing today. Today, we're trying to increase the efficiency of our breath. So keep the back, the shoulder loose and lengthened, creating a lot of space in the upper back. Forget about your knees and hamstrings, right? So keep your knees bent, lengthen your back, and bend forward. Observe your breath here. Take nice and deep 10 long breaths in the posture. Imagine your spine like a spring you're trying to lengthen. You're pushing your hip back and up, taking your chest forward and down, lengthening your spine, right? If possible, you can also hold your ankles and pull yourself down this way. If you feel like your breath is getting affected or getting shortened, come back halfway. You can stay here in the posture. Now slowly bring your hands on the hip. Inhale, come up. Exhale, relax. Now take your feet wide apart, about 3.5 to 4 feet wide apart. Hands on the hip. Exhale and bend forward. Now, again, catch hold of your ankles, or if you can, clasp your big toes. Inhale, look ahead. Remember, when you're looking ahead, you're not just straining your neck and looking forward, you're also lifting your chest up. Again, back is a spring that you're stretching and lengthening, making space here in between your chest and the abdomen, opening up the diaphragm. Exhale and bend forward. Pulling yourself down, your chest and the crown of the head moving down towards the floor, your hip lifting up towards the ceiling, lengthening your breath back. Now inhale, look ahead. Hands on the hip, exhale, inhale and come up. Bring your legs closer. So all these postures that I'm mentioning, you can stay in each posture for a minimum of 10 breaths to a maximum of how much ever you can, right? There is no rule or limit as much as your time permits and as much as your body permits, you can stay in these postures, right? Now, kneel down. In case you have sensitive knees or any knee pain, you can use a blanket, folded blanket to support the knee, right? Now stretch your right leg out. Now inhale, lift your right arm up. Stretch the side of your torso, lengthen and bend sideways. Drop your right hand on the right leg. Sink the hand down. Now remember, if I move my hip back, I can go all the way down. So here we are not trying to do that. Keeping the hip stable, move, bend to your right so that this side of your torso gets stretched. Now lift your left arm up and stretch over your ear. Opening the chest. You can turn and look down, look up, look ahead. Keep your head wherever you're comfortable. And remember to breathe. Inhale, come up. Change sides. Now, while you're stretching the leg out, make sure your ankle and your knee are in one straight line. Right, go ahead. Inhale. Exhale. Bend, bend, bend. Reach down as much as you can, stretching the sides. And lift your right arm up and over the head. This is more effective than doing this. Right? Here, my chest is open. My entire torso is stretched open. Here it's closed. That's not the motive. Right? In case you have any shoulder pain, you can keep your hand on the hip and bend sideways. Now inhale, come up. Relax, exhale. Sit back. Now observe your breath. The change is in your breath. All right. Now sit in Sukhasana. Take your right hand outside the right knee, left hand behind, and twist. While you're twisting, remember you're twisting your shoulder. Okay? You're opening the shoulder to the side, not just the head. So open the shoulder as much as you can. And once you're comfortable, you can turn and look back. If this is not comfortable, you don't have to twist the neck. You're only working with the shoulder. Release and change sides. Opening the chest. Release. Exhale. Now, lie down on your chest, on your stomach or on your chest, down on the mat. Bring your feet together, or you can keep it slightly apart if you're not comfortable. Hands next to the head. Lift your chest up, drop your elbows down. Keep your shoulders relaxed. This is tightening your shoulder, right? This is a relaxed shoulder, where your shoulders are moving away from your ears. Make the space prominent. Lift your chest up. Exhale slowly. Take your elbows out. Bring your right hand on the left hand. Head down to the right. Right knee to the right elbow. Close your eyes and relax. Lying on the stomach is a very relaxing position. Observe how you're breathing here, how your stomach moves as you breathe. Now change side. All right. Now, turn around and lie down on the back. Okay. Hug your knees to the chest as much as you can. Now, slowly catch hold of your big toes. Roll and sit up. Okay. Now, Bring the soles of your feet together. Sit in Baddha Kona position. Close your eyes. Interlock your fingers around the toes. Exhale, bend forward. While you're bending forward, rest your elbows on your thighs or on your calves, pushing your thighs down. Again, lengthening your back. Remember here, let me show from this side. Here, again, instead of rounding your back and trying to touch the forehead to the floor, start to lengthen your back. Did you see the difference in my voice? That's because my breathing got better, right? So keep your breath stable, back lengthened, and bend forward. You don't have to go all the way down. You're just working on lengthening your back and breathing easy in the posture. If your body allows, stretch your arms forward, go down even more. Inhale and slowly come up. Slowly lie down on the back. Hug your knees to the chest. Start to roll your knees around. Start to roll your body around. Massaging your back as you roll. Stretch your arms sideways. Take your knees to the right elbow. Head turn to the left. A gentle twist. Center inhale. Exhale to the left. Center inhale. Stretch your legs out to Shavasana. Keep your legs apart, arms apart. Close your eyes and relax the whole body. Long, deep breaths in Shavasana. With absolutely no tightness in any part of your body. Stay in Shavasana for about 5 minutes, 2 to 5 minutes. Now slowly move your fingers, toes, head from side to side. Interlock your fingers, stretch your arms over the head. Bend the knees, turn to your right and slowly sit up in a comfortable posture. We'll practice a bit of pranayama now. Observe your breath. Now see if your breath has changed in any way from how we began to now. Observe all the changes in your breath. Now, keep your left hand in Chin Mudra, right hand Nasikagra Mudra. Bring your index and middle finger to the eyebrow center. This is Nadi Shodhana, or popularly known as Anulom Vilom. So you can either keep this mudra or this mudra, where you bend your index and middle finger, touch it to the base of the thumb, whichever is comfortable for you. Now exhale completely. Press the right nostril using your thumb. Inhale through the left. Press the left, exhale through the right. Inhale through the right. Exhale through the left. We do 10 rounds of Nadi Shodhana breathing. Remember not to force your breath. You're not doing here. Natural breath. We are only directing the breath in a different path. But we're not changing the course of the breath. Once you're done with 10 rounds, release your hands. We'll do Brahmari Pranayama. For this, take your thumbs towards your ears, index finger to your eyebrow, middle finger to your eyelid, ring finger to the nostril, right outside, next to the nostrils, little fingers towards your lips. Inhale. 10 rounds of this. And now bring your palms together, chin down. Say a small silent prayer. Surrender your practice to the higher forces. Chin up, rub your palms. Place it on your eyes, face, massaging your face. Bring your hand in front of your eyes, blink open your eyes and listen to you. Thank you. End of practice.
That was excellent, Dr. Ms. Swati. I think it was a wonderful session. A couple of questions.
Yes.
Now, what's the ideal time to do these exercises?
So this practice can be done during any time of the day, actually. There was not a lot of deep postures. So it's not necessary for you to be empty stomach for this. So ideally, it's good to do it in the morning when we begin the day, or in the evening while we are at the, and we are ending our work day and we want to rejuvenate and refresh. These practices or these postures are amazing to do that. Or you can also do it just before going to the bed. And the pranayamas at the end also help in regulating certain hormones in the body and deeply relaxing the body, helping you sleep better. So morning or evening or before bed is a good time.
Many of these people who work, especially in the IT sector, and Bengaluru is the center of this IT sector, they face this pressure cooker atmosphere in the offices where they are deeply stressed. So are there short, de-stressing exercises that they can do in the office without, having a yoga mat or whatever it is, can be had.
Yes, of
to calm
course.
your mind.
There are a few stretches that you can do even while you're sitting, right? So if you want, I can show a couple of stretches on a chair that you can do. Initially, we did the, stretching the neck and the shoulder. That can be done wherever you are. That releases a lot of tension around the shoulder because we are sitting like this all day, right? So that helps in releasing. We can do a few forward bends, sitting, stretching our arms at the desk and just bending forward. That also helps. So just a few movements here and there, moving our arms this way or this way while sitting on the chair, taking a short break. All of that helps.
I suppose deep breathing will also help where you have short spells of meditation probably for 2 minutes.
Yes. Meditation in an office environment may not be possible, but deep breathing, yes, of course. Long inhalation from the nose and blowing the air out of the mouth for about 10 to 15 times really helps in regulating the breath and bringing the rhythm of the breath back to normal. So that also can be done.
Sure, you have any questions? My co-moderator last.
थैंक यू सर. स्वाति जी, मेरा एक सवाल है आपसे.
हाँ जी.
स्ट्रेस मैनेजमेंट के लिए एक आसन बताइए, सिर्फ एक आसन जो सबसे ज्यादा प्रभावी होता है और क्यों?
अच्छा, तो स्ट्रेस मैनेजमेंट के लिए एक वेरी गुड आसना है which is विपरीत करणी, where you just take your legs up on the wall and lie down. So this is how you do it. This you can do at any time. If you're working from home, you can also lie down this way at any time during the day, right? So this works very well in terms of regulating the stress because one, it completely supports the back. Actually, when we are lying down, we are not exactly supporting the back completely. So this completely supports your back. It relaxes your breath. It helps in circulation. यहाँ पे we carry a lot of tightness and stiffness around the legs, which is released in this posture. It works very well with regulating the breath as well. So if you've had a stressful day, come back home, do this posture for like 5-10 minutes and you can see the magic. So this is one posture that I would say like a holy grail posture for any stress related issue.
Thank you, Swati ji. Mr. Shankar.
Thank you, Ms. Swati, for this wonderful session. I think those who have seen this session probably may feel a bit distressed, and also you should continue. And the biggest thing about all this yoga is that you should not have any gap. You should practice it continuously so that it's not a one-day affair, a two-day affair. So
yes,
I think,
of course. This is not short-term. I mean, of course, you'll get a short-term benefit of immediately de-stressing you by deep breath or whatever. But if you're not addressing the core of it and if you're not practicing it, it's going to come back. So it's very important to practice regularly so that calm state of your mind is maintained for a longer period of time.
Well, thank you, Swati. I think wonderful having you with us, and wish you.
Thank you. Wonderful being here.
Weather in Bengaluru, and
thank you.
Thank you.
Thank you so much. It was wonderful meeting all of you.
Thank you.
Namaste.
We now have the session intro video. I request the admin to play. Welcome back. We are live on Facebook and YouTube. We now enter another segment called Technovation, our fortnightly segment on IT innovations in healthcare. The topic in this episode is artificial intelligence, a pleasant present to healthcare. And to discuss on this, we have with us Dr. Geeta Manjunath, the founder, CEO, and CTO of Niramai Health Analytics, and has led the company to developing a breakthrough AI solution for detecting early stage breast cancer in a non-invasive, radiation-free manner. She comes with over 25 years of experience in IT innovation. Before starting Niramai, Geeta was the lab director for data analytics research at Xerox India. She has received many international and national recognition for her innovations and entrepreneurial work. She's also an inventor of 16 US patents and more pending grants. The next speaker is Dr. Anuj Kumar Bharati, an assistant professor at Bennett University and a PhD from the Indian Institute of Technology, Jodhpur. And he did his work in the emerging area of cognitive science under the Department of Electrical Engineering. He also gained his experience in designing and conducting fMRI experiments at the Institute of Nuclear Medicine and Allied Sciences, New Delhi. His focus is to study neural regions contributing to the feature binding process through imaging, developing automated solutions. I am Shankar, President of Health Foundation, and I will be moderating this session. Dr. Geeta, I was told you're unwell, and I hope you will not be in much of a trouble, and we wish you speedy recovery also. If you are at any point under stress, please let us know, and we will of course give you some time.
Thank you.
My first question, Dr. Geeta, is for the viewers, can you briefly explain what actually is artificial intelligence and how is artificial intelligence used for detecting early stage breast cancer in a non-invasive, radiation-free manner?
Absolutely. See, actually, if it's okay, I can share some slides and then take you through the details of what this is, because it's much more easier to understand for the audience. Yeah. Thank you. So I hope you can see my slides. Okay, good morning, everyone. It's a pleasure to be speaking with all of you. And thank you, Dr. Shankar, as well. So when you look at artificial intelligence for healthcare per se, I would basically divide this into three main categories. AI, as many of you would know, is use of computers to make some decisions that usually humans are capable of doing. Right. And typically how this is done is trying to sort of, model mathematically with probability and statistical theory behind it, mathematically model the way the brain functions in terms of, learning new things. Like, for example, if there is a baby, you're teaching the baby which is a car versus which is a van, which is a dog, which is a cat, and so on. How would you do that? Typically you show pictures of cats and dogs and vehicles, and also show real images of these real cats and dogs, and then say, okay, this is a cat, this is a dog, right? And there are different, varieties of cats, varieties of vehicles, and how does the baby learn this, right? So seeing some examples of what each of these look like, the baby actually is making a mental model of some kind of a pattern behind, which signifies or which it enables the baby to make a recognition or a pattern recognition of different types of objects. In this case, cat, dog, bus, van, car, and so on, right? So what artificial intelligence is, the field of science, computer science, where using mathematics to model this function of learning patterns, right? So that's roughly how we would say. And also AI is now changing the way things are done in almost all fields. And we are here to talk about how healthcare is being modified. And particularly talking about, AI in medical imaging. you would have, many of us would have seen these images, and there are also brain. And I think our next speaker is going to talk about the brain and MRI related aspects of it. What I want to sort of, focus on is radiology in general, where you use these machines to actually look into the body, because you cannot actually, if you want to know whether somebody has cancer, you cannot actually poke every bit of the skin. Obviously you need to know where is a likely lesion, where is a likely tumor, and then you can do a tissue test at that particular location, right? And so in order to look into the body, we have different types of imaging methodologies, right? And so it could be, MRI, it could be X-ray, it could be ultrasound, it could be an infrared ultrasound, and so on, right? Many methods, but so all of these machines you're seeing are these imaging devices, and use of AI will help in identifying the likely location, right? I mentioned briefly. So this is usually and traditionally done by expert radiologists who are trained to look for abnormalities in images. But what happens when you're looking for early detection? Because early detection is very, very important to save lives. When you do early detection, you're actually screening and imaging almost everyone in a preventive manner. When you're trying to do that, there's huge lot of data or images and tasks, right? Interpretation tasks. The radiologists, becomes a shortage of expert radiologists, because there are only about 18,000 radiologists in the whole of India, for example, right? So this enhanced productivity of the radiologists is very much needed in order to have faster diagnosis, better diagnosis, reduce the errors in diagnosis, and overall increasing the patient outcome of detecting, abnormalities early. And as I mentioned, AI really loves pattern recognition. It does very well. And that's why it's a good synergy between the benefit that AI can provide to healthcare and what radiology needs. And then one of the primary areas where AI is used in healthcare is in radiology. And I'm going to talk about briefly, for 5 minutes or 10 minutes, about how AI is used in breast cancer diagnosis. And a quick statistics: it is one of the largest cancer killers in women. 680,000 women died in 2020 because of this disease, and almost 90% of them could have been saved. Yes, it is possible to save lives if we can detect cancer early. Particularly breast cancer is the most manageable of all the cancers, and early detection is very, very important. And if you look at why early detection is not happening, there are several gaps today. Mammography, which is the standard for breast cancer, has some issues, such as, there's a concept called dense breast, especially for women under 45 years of age. The X-ray of the breast, which is basically the mammogram. Mammogram is an X-ray. It looks something like this. The whole breast appears white. And how do you find a lesion which is hard stuff, which is a white spot in this? It becomes very, very difficult. And so many women get unnoticed for their breast cancer early. And so they really detect when they're able to feel it as a lump, and that's already stage 3. And how do we enable early stage breast cancer detection? And that is a question that is not yet answered so far, right? And then it's not just women under 45 years of age, even women above 45 have dense breast, almost 50% of them. And even in those cases, mammography is not effective. And then, of course, there's affordability and accessibility issue for many imaging modalities, and shortage of radiologists, which also increases the cost of screening. And then also because use of X-rays is not really the best method of, detecting cancer, because every screening is actually increasing the cancer risk for the lady, which is crazy, right? So with all this, what's happening is only 10 or 7% of women are actually going through preventive screening in the whole world, and it's less than 2% in India. So how do we change this? And that's where, we as AI experts, we wanted to see whether we can make a difference, right? And then we looked at mammography. Of course, there are several works on use of AI on mammography to improve or make it faster for analysis. But the concept and the issue of dense breast still remains. Irrespective of how much of AI you do, it's always looking at X-rays which of dense breast. So we came up with a new method called thermalytics, where we just measure the temperature variations on the chest. We create a thermal image, which is basically a map of the temperature of the different tissues. And so you get an image of like this, where every picture, every dot is signifying the temperature. Now, using just this to visual analysis is not it's very subjective, not accurate. So we actually developed an AI on these thermal images to have a very new method of detecting breast cancer, which can detect much before a lump is felt. All one needs to do is, this is a small device, very portable device. She just sits in front of the device for 10 minutes and she comes out, her report will be ready. Nobody would have touched her. There is no contact, nobody would have even seen her without clothes. And it's like a changing room experience. She just gets in, she closes the door, she sits in front of the device and she comes out, the report will be ready. And the report is generated by the artificial intelligence algorithms that we have developed over these thermal images. And it does work for women of all ages and it's more affordable and all that. This is a new method that we have developed in our startup, and now of course it's used by thousands of people in the world, and I'm happy to say this is made in India using AI, right? And this has resulted in 26 international patents. So here is a short view of how it works to answer your question.
Get a checkup done. I was quite skeptical before I went for the test. It took me by surprise because the machines didn't touch me. It was all happening from far away. जैसे eye test होते हैं ना, दूर से बिल्कुल वैसा.
So it's a very, very simple test that is now available, and it does use AI, and Dr. Shankar mentioned, right, where is the AI being used. So the thermal images, if you see, you can feel, okay, there's cancer all over these red places. No, only there are certain places where there is. And what are these abnormal patterns? That is what the AI model, picks up. In fact, this whole solution has about 20 different artificial intelligence algorithms. A few of them marked here are, first of all, you might make sure that the quality of the image is good, because garbage in is garbage out. So you need to have good quality data. And then identifying the type of abnormal patterns which may exist. It can be one or more of these patterns. About 117 different patterns are extracted. In fact, more statistical patterns are also extracted. And then they go into what we call as classifier, which is a machine learning algorithm, which says whether yes or no, right? It is trained before using historical patterns of cancer and non-cancer patients, and it generates a report automatically. And we have also clinically validated to show that this technique is much better performing than mammography. As you can see, 66%, 67% has become 100% in this. And so that's sort of, a lot of clinical validation needs to be done for any AI model. And also regulatory approvals are absolutely needed to be used in real world. And there are very, very few solutions, AI-based medical imaging solutions, which have gone through the regulatory clearance of FDA and CE mark. And we have, I'm happy to sort of, share any further information you need on this. And because we believe in making this happen on the ground. We really want to save lives using AI and healthcare and thermal imaging, and essentially from breast cancer particularly. And so we actually went through all of these grilling regulatory requirements. And then now we have actually, using AI on thermal imaging, developed this new method called thermalytics, which is completely no touch, no see. The lady is inside, sitting in front of the thermal sensor, and the technician is outside, like a changing room experience. And the accuracy is actually much better than any of these methods, and being done at 1/10 the cost of the current methods, right? It's of course available in 25 cities, and something that can be applied to many other type of cancers, not brain cancer. I know that's the topic of today's discussion, but AI, of course, can be used for analyzing even, brain tumors, mainly through the MRI and so on, which I think my next speaker is going to talk about. But what I shared now is the use of AI for breast cancer detection, which is a very unique solution, just got multiple awards also recently. Thank you so much for, asking the question and allowing me to share the story.
Dr. Geeta, will thermal imaging replace mammography, and can this be used for population-based screening?
It has already replaced mammography in many hospitals and diagnostic centers where mammography is not affordable, because a mammo machine costs 80 lakh rupees, and how many small diagnostic centers can afford it? Having said that, in developed world where mammography is fully standardized, it's available in available for the last 30 years. Everyone is doing it as free. The government is providing it as a free service. It will take time to replace, but I would say it can still be, adjunct or an additional supplemental method for mammography in countries like US, in US and countries in Europe, where we have approval as well, where it will be used for screening younger women and women under 45. However, in countries like India, Philippines, Indonesia, Africa, many other places, right, it is being currently used instead of mammography because it does have better accuracy than mammography.
Now, speaking of mammography, it is still there, but there is an issue here that it is less sensitive in women with extremely dense breast tissues than fatty breast tissues. And women with extremely dense breasts are 3 to 6 times more likely to develop breast cancer than women with almost entirely fatty breasts and 2 times more likely than the average woman. Can artificial intelligence help out in such cases through supplemental MRI?
Yeah, so it depends on the country. Yes, absolutely, dense breast is an issue, and that is where I was mentioning about thermolytic solution, which is definitely a solution for dense breast women. We have done several studies on dense breast to show how the accuracy of this is much better than mammography. Using supplemental breast MRI is definitely one option, but I think people who have seen the MRI machine, right? It's a huge machine. People have to go. It cannot be used for screening at all, right? Typically what is recommended is for high risk women who have maybe a family cancer history, who already have a BRCA positive, gene mutation. Then we have a case for doing breast MRI on the lady, because many times it has to be contrast enhanced and it is not great for the body, right? So what is generally recommended, and this is where at least in India it is getting standardized, more than 50,000 women have gone through and 100 plus locations, is to do thermolytics for screening, and then for positive patients, then you take them through a diagnostic workup, which can include breast MRI in addition to an ultrasound, for example, right? So that would be the best method. Yes, I think somewhere you asked me whether it can be used for population screening. Yes, thermolytics can definitely be used for population screening as well as preventive care in diagnostics and diagnostic centers and hospital. For example, almost 150 centers today in 25 cities have this test inside the hospital. Of course, we have done several camps as well, because it's a portable non-radiation based test which can be set up anywhere. In fact, we've also started home screening with this, because many women cannot even come out of the home because of COVID, and at least it was becoming better, but again you're seeing the next wave coming up. So this home screening is also something that people have availed, which is possible because it is radiation free. Otherwise it's not, you can't do it anytime, anywhere. Yeah.
You gave a good introduction to artificial intelligence, but what exactly is the difference between artificial intelligence and augmented intelligence?
So augmented intelligence, I mean, it's all terminology at the end of the day. So basically augmented reality is something that people talk about, where you have something, there's a picture in front, and then you picture or anything that you're seeing, you're walking, and then you're in front of a museum, you're in front of Parliament, you're in front of Vidhan Soda. Then you want to know the information about it, and then generally there are these applications where you can just flash the image, and then immediately the data about it is fetched. So there are multiple AI things that are happening. You have to do a recognition of what is out there, and then figure out what is the most relevant information that the person is looking at. So there's personalization as well. Now the same thing when you look at from a human body perspective, right? So trying to bring in the required information for the doctor, augmenting the intelligence of the doctor by bringing in information maybe from research sources, from patient history, medical records, and then augmenting the current knowledge based on the current image through sufficient accurate information which is relevant to the person and to the right the particular question in being discussed. I think is something sometimes called as augmented intelligence. But at the end of the day, artificial intelligence has different methods of making this decision. It could be on images, it could be on data, it could be on text and video, and so on and so forth. And also it could be based on rules like logic-based rules, or it can be based on expert semantic rules, or most of the applications today are based on what is called as machine intelligence, like machine learning. And so that is purely based on probability and statistics. And once you have this information, how you show it, when you show it, is where the augmentation or replacement for decision making, all that comes in terms of how the AI algorithm itself is being used in the context of the application.
I'll give you a short break, a sort of rest for you, and I'll come back to you again, and I'll move on to Dr. Anuj now.
Sure, thank you.
Dr. Anuj, can you explain to our viewers what exactly is functional MRI?
Functional MRI, generally we talk about whenever MRI or any imaging. So we take a structural information which is residing inside the body. For example, if you are taking a structural MRI, it will show you which brain area lies where, just like. Functional MRI is a method when we take the live scanning of the brain and we can check, like if the person is doing the memory task, so which of the brain area is consuming the oxygen at that time. So functional MRI is a dynamic MRI which gives you the dynamic activations inside the brain related to a particular cognitive or psychological process.
The human brain is one of the most complex and fascinating organ. And your focus is to study neural regions.
Yes.
Can a combination probably of, you see, since you are doing this, can a combination of combination of artificial intelligence and brain scanning technology help doctors in reducing or removing specific fears from the brain, increasing self-confidence, and even alter personal preferences?
Personal preferences, yes, actually. So whenever we are doing the fMRI and we can apply the artificial intelligence over a particular set of people, we can get the neural regions related to that particular cognitive process. So depending on the brain regions we are getting, we can give the certain practices which can alter the idea behind this, the particular cognitive process, which is you're talking about the personal preferences. Yes, we can do that.
Yeah, you were speaking about, fMRI can measure the brain activity by detecting changes associated with oxygen levels and blood flow. Yeah. And this is used to predict types of brain disorders.
Yes, it is used, and it is vastly used in all over the world these days. And the people also using artificial intelligence to develop the early detection of neurological or psychological disorders. For example, if you're talking about Alzheimer's or Parkinson's, so we can get the details whether the hippocampus or the frontal cortex is normally responding in a particular memory task or not. So we are also in a stage to develop the cognitive biomarker for these serious diseases. If you talk about the Alzheimer's, there are memory and perception tasks. So there are perception processes. For example, if I talk about my work, so I am working on the feature binding, which is validated in Europe to be considered as the cognitive biomarker of Alzheimer's. So if we can detect the deterioration in feature binding at an early stage, so we can predict whether the person is going to be going to have Alzheimer's in the later stage or not. So yeah, we can detect that.
How early can you predict?
At the adult age, yeah, before the mild cognitive impairment.
Okay. Yeah. Now this question of mine is connected to the earlier one that I asked you. It is said that decoded neurofeedback can lead to the development of new interventions and treatments for patients with post-traumatic stress disorders, phobias, anxiety disorders, and other mental health conditions. What's your view on this?
Yes, definitely. Neurofeedback is currently in trend, and we generally, like apart from fMRI, we do the neurofeedback through EEG also, electroencephalogram, and post-traumatic stress disorder, or whether you talk about the anxiety disorder, using neurofeedback, it is actually helpful to reduce the level of it. Yes.
And can artificial intelligence help in problems related to mental health?
Yes, we are also in a generation to work on the conversational layer. Lots of people are having shyness to talk about the mental health or psychological problems they are facing. So we are also in a generation to develop conversational AI, which is the handy device the peoples are having, and which can give the immediate counseling or the immediate suggestions, or I'll say immediate help to the person who is having a particular types of disorder or problems, I would say.
Now, what could be the probable obstacles in implementing artificial intelligence-based framework for healthcare?
Yes, because day over day, we are trying to optimize the algorithms. And for that, we need a high computations, graphical computations, and the memories. So we are, one side, we are trying to develop the mobile devices, the Fitbits or the smart devices. On the other hand, we want access a high space to do the computation, to give the high accuracy, of course. So these two things goes together, create an obstacle in that. So if I talk about, let's say, if I want to make a smart device to detect the Alzheimer's at the early stage, for that, I need a high computation machines. Although cloud is helping, but that is also going to be saturated in the near world. So this is one of the obstacle these days, to have the space for the high computations.
Yeah, in the earlier question answers, Dr. Geeta did mention that we have a shortage of professionals in the radiology sector and we have issues with it. But then my question is, will artificial intelligence reduce the importance of the role of medical professionals, especially radiologists?
It is generally thought that if the machines, automated solutions came in the pictures, then the importance of the clinicians or the medical professionals will get reduced. Actually, it's not. So due to artificial intelligence, we are trying to make a global framework, or a framework where the people from the far apart is connected to the rural areas or remote areas. So actually, it is increasing the reachability and the importance of the medical professional to the common people. So it is actually increasing the importance.
In your CV, it's mentioned that about detecting sort of feature binding process. So what exactly is feature binding process through imaging?
Feature binding process. So it's just we need to think about it in a more philosophical way. So whenever you see a red apple, so red apple is having different features. It's color red, or it's a shape, it's a particular type of shape, or it's a density, it's a motion, or it's a location. So these different features are processed in different brain areas. Somehow these features come together and give us the unified object, or the unified image of the object apple, right? But then the picture comes that if I see 4 apples together, or 4 fruits together, or 4 fruits one by one, will there be a difference between the process if I see all the objects sequentially or simultaneously? So there is, if we take the philosophy of Einstein, that time and space is the same thing of in a different dimensions, but in brain, time and space is measured in a different way. So sequential learning is having its own characteristics, and simultaneous learning its own characteristics. Therefore, the difference of feature binding, if I see simultaneous object and sequential object, is differs in the brain. Yeah, this is the feature binding.
You mentioned about how functional MRI gives you a picture of the live brain depending on how the blood flows and oxygen levels are there. Now, can fMRI be used to detect blood flow to aneurysms and brain tumors and help surgeons to clamp the blood vessels at the right place?
Yes, at some extent, fMRI can be helpful, but these days, according to me or according to my reach, this is not much useful in terms of detecting the blood flow in brain tumors, because brain tumors is a structural difference which we can see in the brain. So mainly for the brain tumors, we prefer the structural MRI. Although for differentiating which type of brain tumors reside in the brain, we use artificial intelligence for developing automated solutions. Yeah, the structural MRI is preferred.
In your, what is the most exciting feature that is happening in artificial intelligence in the human brain?
What is the most exciting features of artificial intelligence?
Most development research in this one happening currently.
Yeah, according to me, it's explainable AI. For example, Geeta Madam very clearly said artificial intelligence is more about decision making. So for example, if I see a particular MRI, there is a tumor or not, or is the tumor is having the malignancy or not, right? But after all, in the last, it's a machine, and there is a chances for having the error in the automated solutions. Therefore, we are developing towards the explainable AI. So whenever the machine is making a particular decisions, so we are not going to trust it or distrust it. So the thing is that explainable AI comes with a decision, also an explanation why that decision has been made at that particular data or image or text. Yeah, explainable AI is the new trend.
Oh, that's right. That's a very exciting era because these are all developments that are taking place that will help the physicians actually come to a quicker decision.
Yeah,
I'll come back to you, Dr. Anuj. I'll go back to Dr. Geeta. Dr. Geeta, coming back to you. Researchers in India have built algorithms for 14 of the most popular TB drugs, each of which works best on certain kinds of mutations. So when a TB patient comes in, they take a DNA sequence from the patient, and the artificial intelligence system can quickly identify the particular form of bacteria and which drug will work best. Traditionally, it is often a trial and error process for the doctor in arriving at an accurate treatment. Now, your comments, and can this be applied to other areas as well, is my question.
Absolutely. So use of AI for preventive care, that is, helping a radiologist or even having an automated analysis for detecting people who are susceptible to cancer for further treatment is one aspect. During the treatment, monitoring the progress of a particular treatment and how the person is improving is another one. Definitely, treatment planning is another big area, right? Where different type of algorithms can be used to suggest what kind of treatment is best given. So, for different diseases, different type of radiomics, we say, right? There's a whole lot of work on what kind of information is best suited for what kind of disease, or can we get information from all modalities, like from radiology images it is radiomics, from gene marking it will be genomics, and so on and so forth, right? So you can actually look at multiple omics, we say, right? And then model the algorithm in a way that which treatment is better. Again, it boils down to simple training, appropriate training and training of the AI models. To explain why this is. So typically what happens, the way you build the treatment suggestion, treatment planning algorithms is that you actually look at all the previous patient data and then see for which patients, which kind of drug actually is suited. The TB example, we talked about 15 different drugs. Yeah, but still you have the record of which of the patients benefited from which drug, and in which cases the doctor had to change the drug in order to make it effective, right? So when you look at all of these different types of drugs and try to model the cohort of patients who actually reacted or responded well for a particular drug, you kind of model the characteristics of these patients who responded well, and then that becomes a classification technique for one particular drug. Now, when you have 15 such classification techniques, one thing I want to mention is, some of you, all of us would have done like a high school probability math kind of thing, right? So the probability value is always between 0 and 1. Right? So what a machine learning algorithm at the end of the day gives you a probability score, saying that what is the probability that this particular patient belongs to class 1 versus class 2. Okay, let's say class 1, right? That is is treatable with drug number 1, right? Let's say that is the class 1. So if it says probability 0.6, and for drug number 2 it is 0.7, for drug number 3 it is 0.8, then whichever has the higher probability of success, right? That becomes the recommended method for drug. So it's a very, very simple use of same type of AI algorithms in different scenarios. Yes, for treatment planning also, if you have enough data, historical data about patients who have used this drug and succeeded and hopefully failed as well, it will be much easier to develop it for any disease, or most diseases, I would say, as long as there is enough data for training, as well as you have an opportunity to collect the similar kind of features from the unknown patient, unknown sample, we say, basically. Yeah.
We have a question from Dr. Chandrakant. He says that since thermal screening is used for detecting spots in the breast, can this also be applied for cardiovascular? Basically seeing where the calcification is, how it is developing. Can you catch heart diseases earlier?
So it is definitely usable for several abnormalities in the body, many types of cancers also. Cardiovascular, we will have to analyze, but the nodules which are appearing, even for cardiovascular diseases, there are nodules which appear, at the throat area, the chest, top of the chest, right? So those things can be detected, but we have to do more research. If there is a doctor interested in working on this, I'll be happy to collaborate on this. There is no prior work in that area. But what I should say is, if, for example, for some abnormality which is deep inside the rib cage, it may be difficult to use thermal imaging. However, if there are symptoms which are appearing closer to the chest, closer to the skin, like maybe 5 centimeters within the skin, they can be detected using thermal imaging. And just one more point, thermal imaging can also be used for detecting vascular disorders. So basically, when such a thing is happening, some other area in the blood vessel, right, is actually behaving differently. Like, for example, if there is a cancer, then some blood vessels, it's called vasodilation and neoangiogenesis, right? So newer blood vessels are getting created, blood vessels become bigger and so on. And when you look at the symmetry of the body, right, the one side versus another side, you can actually model that also. So what I'm trying to say is, if we may not be able to detect exactly the location of the tumor in, let's say, cardiac related issues, because it's too deep inside, but if there are signals in the blood vessels which are feeding to these areas, those can be picked up, and then a final diagnosis can be made. And I'm happy to work with the interested parties to develop anything similar.
Yeah, that's interesting. So it's possible.
Yeah, some of it is still research. Yeah.
I'll come back to you again for one more question. Dr. Anuj, researchers in India are now using signal processing, 3D visualization, and 3D modeling to build a neuroinformatic platform that can give unique insights into brain structure and functions. This can answer questions like, does this person have early forms of dementia? Will they move to amnestic forms of dementia? Does this patient with psychosis have schizophrenia with bipolar, or are there other indicators? What's your comment on this?
Definitely. It's a very commendable move, and it's actually working. I have seen it. I have done it. So the thing is, even talk about a psychosis like schizophrenia or dementia or any other problem. So neuroinformatics platform, for example, gives take the inputs of structural and functional MRI, analyze the connections between the brain regions, and gives the preventions and early detections of these psychological disorders. This is currently working and actually going in a very, very, very good directions. Yeah.
Now, artificial intelligence systems can look at long fMRI videos to figure out the dancing patterns in the brain, something no radiologist can do. Now, they can take all that information and map it back to 3D space so that the doctors can visualize in the way he or she understands it best to form a treatment pattern. What's your comment on this?
Yes, it is. This particular research at a very naive stage, I would say that. So the idea of this thing to take the fMRI as an input and reprojecting or reconstructing all the information which is happening in the brain in the real world to see whether the treatment patterns or anything which is going in the brain is going in the right directions or not. So this research is at a naive stage, and let's see where it goes.
And now this question is to both of you, Dr. Geeta and Dr. Anuj, on a scale of 1 to 100, where do you think artificial intelligence is currently placed?
So, from my side, it's the predictability is different because the things are revolving day by day. So for now, if I say the 100%, if I say the next day it goes 110%, definitely it's a revolving. But still, if I talk about a particular country, India, so I think we have a scope to get 100%. So I would say it's 70 to 80%.
And still a lot of areas to be still explored.
Yes, it is.
Yeah. So from my perspective, if you look at AI for, let's say, consumer activities like finance, e-commerce, and so on, we are 9 on 10 in the globe and possibly in India as well. But when you come to healthcare, we globally also we are just 5 on 10. Right, and India is probably 3 on 10. And I feel there's a lot more to be done. The reason I'm giving this is very, targeted diseases. We have gone all the way. Even today, US FDA, which is the most, stringent regulatory body, doesn't have a method or a process even defined for AI algorithms to learn on the go. Like, for example, if I have to apply for a device which uses AI, for very few handful only have been approved. And I'm glad to say, Niramai's Smile 100 is one device. I think we are probably only 2 companies in India who have got AI approval, AI model approval from US FDA today in the whole of India, right? So this I'm confidently saying, looking at the databases, I'm saying Indian companies. So we have a lot more to do in India, and we can do it. And, there are also new thought process required to say, what do you mean by automated analysis? Can we have a machine make this decision? And I'm glad to let you know, for breast cancer, we've been able to do this, right? For making the triage decision of red, yellow, green, no doctor is involved. A simple health worker can actually use this. It is possible. And I feel these kinds of screening services can be done for every disease, and it kind of bridges the gap between the haves and the have-nots. It could be the developing and the developed world, or even the urban and the rural ecosystem. And so there's so much more to do, and more research needs to be done, and more policies have to be put. And most importantly, regulatory things. We can't have some bunch of, enthusiastic AI, engineers come together, build a model and start releasing it to public. We need to have proper, governance in place to actually say, yes, this is regulated, right? It's like a driving license, right? You better know how to drive before, or even make the car, right? So I think we need to have a lot more things to be done, but it's a huge potential, and it's going to be the huge growth area in terms of jobs, in terms of research, and in terms of newer things, innovations that can come in healthcare. And I'm very excited about the future of AI.
I was just a bit curious to know what is the full form of Niramai, though I guess that the last AI stands for artificial intelligence.
Yes, last AI stands for AI. Niramai in Sanskrit means no diseases. Niramai, no diseases, right? Mm-hmm. And it has an expansion, non-invasive risk assessment through, machine artificial intelligence. So, Sarve Santu Niramayaha, let everyone be healthy.
Yes. Yeah, your last comment, Anuj, before I wind up the session.
My last comment is to encourage the AI people in the healthcare sector, because today I don't see any health problems or mental health problem which is untouched from the perspective of AI. If I read any research paper, I can find any particular disease which is being solved or being early predicted towards AI. So I would say, as a last comment, the AI will be the future in healthcare.
Thank you. Thank you very much to Dr. Geeta, and we wish you get well soon. Wish you speedy recovery, and thank you, Dr. Anuj. It was wonderful hosting you on this particular session. Thank you very much.
Thank you.
Thanks a lot.
We now move on to the next segment, which is Health Nama, the popular capsule put together by my co-host Kishore Malviya, and this time the topic is diabetes remission. Over to Health Nama.
नमस्कार। हेल्थ नामा में आज हम डायबिटीज़ की बात करेंगे। डायबिटीज़ एक लाइफस्टाइल बीमारी है जो घर घर मौजूद है। गलत खान पान और रहन सहन की वजह से ये अब कम उम्र के लोगों को भी जकड़ रहा है। तो क्या जिसे डायबिटीज़ हो गया है वो जीवन भर दवा पर निर्भर रहना पड़ेगा उनको, या वे अपनी दिनचर्या को ठीक कर दवा या इंसुलिन से मुक्ति पा सकते हैं? इसी विषय पर हमने डायबिटीज़ के कई विशेषज्ञों से बात की प्रस्तुत है उनसे बातचीत के निकले नतीजों पर। क्या रेमिशन जो आप बता रहे हैं जिस तरह का, वो लॉन्ग लास्टिंग है, परमानेंट है?
अभी जो स्टडी हुई है, जिन लोगों ने 10 से 15 किलो वेट कम किया, जो रिकॉर्ड है, एक डायरेक्ट स्टडी हुई है अभी बहुत ही, जिसको कहते हैं कि उसका मतलब ये था डायरेक्ट रेमिशन ट्रायल। उसमें इन्होंने ये देखा कि लोगों को जिनको 850 कैलोरीज खाना दिया गया एंड यूकेपीडीएस उसमें हुई, तो उन्होंने देखा 15 साल तक रेमिशन रहा इन लोगों के अंदर। जो लेटेस्ट रिकॉर्ड है कि लास्ट मतलब जो है लॉन्गेस्ट कितना रहा। और अगर हम बात करें जिसकी अभी बात चल रही है, मैंने जैसे शुरू में कहा मालवीय साहब आपको कि 3 तरीके हैं। पहला तरीका तो यह है कि लो कार्बोहाइड्रेट डाइट दे दी आपने, उससे जो है उसका वेट कम हो गया, एक्सरसाइज हो गई। दूसरा हो गया लो कैलोरीज डाइट हो गई। और तीसरा जो है मेटाबॉलिक सर्जरी है, बैरिएट्रिक सर्जरी। क्योंकि बैरिएट्रिक सर्जरी से ये देखा गया 80% लोगों के अंदर 2 साल तक रेमिशन रहा, दवाइयां कम हो गई, वेट कम हो गया। लेकिन अगर ड्यूरेशन लंबी जाए तो फिर वो रेमिशन रेट जो है कम होता चला जाता है, फिर वो 30% रह जाता है, कईयों को दोबारा हो जाता है। तो इसलिए ये कहना कि परमानेंट होगा, उसका इतना रिकॉर्ड लंबा नहीं है, क्योंकि अभी 12 से 15 साल ही हुए हैं। और इसका मेन जो बेसिस क्या था, उसका क्यों इसका सारा कुछ हुआ, एक ट्विन साइकिल हाइपोथेसिस थी, जिसके बेसिस में सारा रेमिशन का जो चर्चा हो रही है और जो सारा वर्ल्ड में चर्चा हुई, तो वही ट्विन हाइपोथेसिस, ट्विन साइकिल हाइपोथेसिस वही है कि 2 चीजें, 2 जगह फैट जमा हो गई अपनी पैंक्रियाज में और लीवर में, उसको अगर आपने रिड्यूस कर लिया वेट कम करके, तो आप डायबिटीज को रेमिशन में ला सकते हैं।
इंसुलिन दवा से ज्यादा सेफ है, तो क्या सभी डायबिटिक को इंसुलिन लेना चाहिए?
नहीं, इंसुलिन और दवा दोनों ही दवाई ही है, और दवाई सेफ तब होती है जब वो दी जाए जिसको जरूरत है। ठीक है, जैसे कि दवाइयों का काम करने का अपना तरीका है, इंसुलिन का काम करने का अपना तरीका है, और ये डिपेंड करता है कि डायबिटीज होने के पीछे क्या मेन कारण है, उसके ऊपर डिसाइड होता है कि दवाई ज्यादा सेफ रहेगी या इंसुलिन ज्यादा सेफ रहेगा। तो जैसे हम देखते हैं ब्लड शुगर कंट्रोल या शुगर कार्बोहाइड्रेट का मेटाबॉलिज्म जो है बॉडी में एक कैपेसिटी और लोड का मॉडल मान लीजिए आप कि हर इंसान अपना एक कार्बोहाइड्रेट मेटाबोलाइज करने का कैपेसिटी लेके पैदा होता है, और जैसे ही उनकी उम्र बढ़ती है या जिंदगी आगे चली जाती है, ये कैपेसिटी मॉडिफाई होती रहती है। अगर अच्छी लाइफस्टाइल मेंटेन की जाए तो अच्छी रहती है, नहीं तो कम होती जाती है। तो ये कैपेसिटी जो है 2 चीजों पे डिपेंडेंट है, एक तो कितना इंसुलिन बॉडी में बन रहा है, और दूसरा इंसुलिन किस तरह से काम कर रहा है। तो कितना इंसुलिन बन रहा है, अगर इसमें प्रॉब्लम है, इसका मतलब यह है कि इंसुलिन कम बन रहा है, तब इंसुलिन देने की जरूरत पड़ेगी। लेकिन अगर इंसुलिन बन रहा है लेकिन उसका काम ठीक से नहीं हो रहा है, जिसको हम कॉमनली इंसुलिन रेजिस्टेंस कहते हैं, तो आप बाहर से भी इंसुलिन देंगे तो वो भी इंसुलिन काम नहीं करेगा, और फिर उसका काम तो नहीं होगा लेकिन उसका साइड इफेक्ट भी होना शुरू हो जाता है। जैसे ब्लड शुगर लो हो सकती है, वजन बढ़ सकता है, वाटर रिटेंशन हो सकता है, क्योंकि इंसुलिन जो है एनाबॉलिक हार्मोन है, वजन बढ़ाने वाली हार्मोन है बॉडी में। तो अगर इंसुलिन डेफिशिएंसी बहुत सिग्निफिकेंट है तभी इंसुलिन देने से फायदा होगा। अगर इंसुलिन डेफिशिएंसी नहीं है, इंसुलिन रेजिस्टेंस है, या इंसुलिन का कार्य ठीक से नहीं हो रहा है, तो बाहर से दिए जाने वाला इंसुलिन दवाइयों से ज्यादा सेफ है, ऐसा तो हो ही नहीं सकता। जब जरूरत है तब अगर इंसुलिन दी जाए तो वो दवाइयों से ज्यादा सेफ, लेकिन अगर जरूरत हुए बिना दिया जाए तो फिर वो प्रॉब्लम कर सकती है।
मेटफॉर्मिन जो है वो लीवर और दूसरे ऑर्गन को नुकसान पहुंचाता है, ये सच है या ये भी मिथ है?
नहीं, ये बिल्कुल भी सच नहीं है। ठीक है, मेटफॉर्मिन इज वन ऑफ द ओल्डेस्ट मेडिसिन फॉर डायबिटीज दैट इज अवेलेबल। 100 साल से भी ज्यादा मेटफॉर्मिन अवेलेबल है। इन 100 सालों में मेटफॉर्मिन के सबसे कम कॉम्प्लिकेशंस है। वो जो भी डायबिटीज की दवाइयां हमारे पास अवेलेबल है, सारी कुल मिला के अगर हम देख ले तो उसमें सबसे कम साइड इफेक्ट या सबसे कम हार्म जो है वो मेटफॉर्मिन नाम की दवाई ने किया हुआ है। जो आप कह रहे हैं, मेटफॉर्मिन का इफेक्ट जो है वो लिवर से शुरू होता है। हिपैटिक ग्लूकोनियोजेनेसिस जिसको हम कहते हैं कि अगर आप कुछ दिन नहीं खाना खाए या कुछ देर खाना नहीं खाए तो बॉडी में लिवर के लेवल पे ग्लूकोज बनाने का फैसिलिटी अवेलेबल है। जिसकी वजह से नॉर्मल इंसानों की ब्लड शुगर लो कभी नहीं होती, कभी नहीं। अगर आप दवाई नहीं ले रहे हैं लो कम ब्लड शुगर लो करने की, तो आपकी दवाई लो, आपकी शुगर कभी लो नहीं होगी। तो ये जो सिस्टम है, ये सिस्टम डायबिटीज पेशेंट्स में गड़बड़ जाती है।
आजकल वजन कम करने के लिए लोग सर्जरी भी कराते हैं, और इस उम्मीद में भी बहुत लोग कराते हैं कि शायद सर्जरी करा के चर्बी हटाकर वजन कम करने से डायबिटीज से मुक्ति मिलेगी। क्या ऐसा होता है?
दिस इज पॉसिबल। और जैसा कि आप देख सकते हैं कि भारतवर्ष में भी आप यदि मिनिस्टर लेवल पे भी देखें तो चार्ज एक समय था जिसमें कि 4 यूनियन मिनिस्टर्स ने, जो कैबिनेट मिनिस्टर थे, उन्होंने बेसिकली बैरेटिक सर्जरी कराई थी। और कुछ के वेट बहुत ज़्यादा थे, डायबिटीज़ भी साथ में थी और तमाम दिक्कतें थी उनकी। तो ये ऑलरेडी एक प्रूव हो चुका है कि बैरेटिक सर्जरी एक रिमिशन, डायबिटिक रिमिशन का एक बहुत इम्पॉर्टेंट प्रोसेस है, क्योंकि ओबेसिटी इटसेल्फ जो है WHO के द्वारा एज ए डिजीज़ क्लासीफाई किया जा चुका है, और जो बहुत ही इफेक्टिव है बैरेटिक सर्जरी, स्पेशली ओवर ओबीस पेशेंट के लिए। तो जैसा कि वर्ल्ड वाइड ये सर्जरी बहुत ही इफेक्टिव है, और डायबिटीज़ पेशेंट जिनको 100-200 यूनिट इंसुलिन चल रही है, और हाइपर इंसुलिनिया में एक्चुअली क्या होता है कि वेट और बढ़ता है पेशेंट। ओके, तो ये एक रिमिशन थेरेपी है और बहुत इफेक्टिव है। इंटरनेशनली जो है ये प्रूव हो चुका है कि बैरेटिक सर्जरी वर्क्स।
डॉक्टर साहब, मैंने कहीं पढ़ा था कि फैटी लिवर डायबिटीज का एक बड़ा कारण होता है। क्या कोई संबंध है फैटी लिवर का डायबिटीज से?
यस, ये तो अब ऑलरेडी प्रूव हो चुका है कि फैटी लिवर बेसिकली डायबिटीज इज नॉट ओनली द डिजीज ऑफ पैनक्रियाज, इट्स अ डिजीज ऑफ लीवर आल्सो। ओके, तो यदि हम प्री डायबिटीज देखें तो वो बेसिकली लीवर के डिसफंक्शन की वजह से ही शुरू होती है। तो मेटाबॉलिक सिंड्रोम, नॉन अल्कोहलिक फैटी लिवर डिजीज, ये एक ऐसी कंडीशंस हैं जिनका हम पहले से, डायबिटीज होने से पहले भी से ही पता लगा सकते हैं। और यदि समय पे हमने इसका पता लगा लिया तो हम बेसिकली डायबिटीज से भी बच सकते हैं। जैसा कि डॉक्टर साहब ने रिमिशन की बात की है, तो रिमिशन इज पॉसिबल इन द प्री डायबिटिक केसेस। ओके, बहुत ज़्यादा लोगों को रिमिशन हो सकता है, लेकिन हमारे यहाँ प्रॉब्लम क्या हो रही है, डिटेक्ट बहुत लेट होता है। ओके, थिन डायबिटीज बहुत ज़्यादा है, दुबले पतले लोगों को भी डायबिटीज हो रही है। ओके, तो उनका लीवर लेकिन फैटी है। तो हमारे यहाँ क्या है कि दोनों प्रॉब्लम बढ़ रही है। एक तो थिन डायबिटीज है जिसमें कि लीवर भी फैटी है, और ओबीज वालों के लिए तो डेफिनेटली वो बहुत ज़्यादा खतरनाक है।
6.5 से HbA1c अगर 6.5 से कम आए 6 महीने तक, तो एक तरह से ये नियंत्रित माना जाता है। तो आप इसको लेकर भी बड़ी गलतफहमी है। कुछ कहते हैं 6 से कम होना चाहिए, कुछ 6.5 से, कहीं तो मैंने पढ़ा था 7 से नीचे भी लोग नॉर्मल मानने लगे।
खाली 7 से नीचे नहीं, कभी कभी हम 8, कभी कभी 8.5 से नीचे भी नॉर्मल मानते हैं। देखिए, अल्टीमेटली हमारा गोल क्या है? एज अ डॉक्टर, एज अ ह्यूमन बीइंग, हमारे पास कोई मरीज आता है, हमारे परिवार में, अब तो आपने खुद ही बताया कि डायबिटीज इतनी ज्यादा फैली हुई है कि शायद ही कोई परिवार होगा, अगर आप सोसाइटी में रहते हैं, आपके फ्लोर पे 4 परिवार हैं, तो शायद ही कोई परिवार होगा जिसमें डायबिटीज न पाई जाए। तो डायबिटीज बहुत ज्यादा फैली हुई बीमारी है, ये कोई अकेली महाबीमारी है, लेकिन कोई अकेली बीमारी नहीं। तो हमारा अल्टीमेट गोल क्या है? हमारा अल्टीमेट गोल है कि क्वालिटी ऑफ लाइफ, इंसान जिसको डायबिटीज हो भी गई है उसकी जिंदगी बेहतर हो। डायबिटीज से सबसे बड़ी दिक्कत क्या होती है? वो होती है डायबिटीज की कॉम्प्लिकेशन। तो हमारे एक मेन एम जो होता है डायबिटीज के इलाज में, वो है कि जो डायबिटीज की कॉम्प्लिकेशन होती है, और केवल डायबिटीज की वजह से होने वाली कॉम्प्लिकेशन नहीं, डायबिटीज बीमारी के साथ साथ जो कॉम्प्लिकेशन होती है, 60% डायबिटीज के मरीजों की मौत डायबिटीज से नहीं होती। हम लोग जब डायबिटीज और शुगर की बात करते हैं, जैसे आप अभी HbA1c की बात करते हैं, तो हम भूल जाते हैं कि हम इंसान का इलाज कर रहे हैं, ये खाली डायबिटीज का मरीज नहीं है। तो हमें चाहिए कि उसकी जिंदगी लंबी हो, उसका स्वास्थ्य अच्छा हो, उसका जीवन खुशहाल हो। उसके लिए हमें उन सब चीजों से बचाना है। डायबिटीज का मरीज जो है वो खाली शुगर का मरीज नहीं है, ये एक जंगल में है इंसान जिसके चारों तरफ जो है खूंखार जानवर उसके ऊपर लपकने के लिए एकदम तैयार हैं। सबसे बड़ा जानवर वो है दिल की बीमारी, हार्ट अटैक, स्ट्रोक। तो डायबिटीज का मरीज आमतौर पर उसकी मौत हार्ट की बीमारी की थी, उसको जो है हमें उससे बचाना है।
दिव्या जी, आप एक डाइटिशियन भी हैं। अभी कुछ दिन पहले साउथ इंडिया के एक बड़े डॉक्टर का वीडियो वायरल हुआ था, आजकल भी बहुत चल रहा है वो, और उन्होंने कहा है कि डॉक्टरों ने साउथ इंडियंस को चावल खाने से रोक दिया है, जबकि चावल में कोई नुकसान नहीं, चावल खाइए, जम के खाइए, कोई प्रॉब्लम नहीं है। क्या सच है? हम लोग क्या इसको सच माने?
एक्चुअली होता क्या है, जब चावल और रोटी, हम जो डॉक्टर्स के पास जाते हैं, जो डायबिटीज पेशेंट होते हैं, उनको क्यों बोलते हैं चावल, आलू, चीनी खाना बंद कर दीजिए। डॉक्टर्स जो है इतनी सलाह जरूर देते हैं अपने पेशेंट को, इसका कोई सर्टेन रीजन होता है। ग्लाइसेमिक इंडेक्स एक, आप समझ लो, एक नंबर असाइन किया जाता है कार्बोहाइड्रेट रिच फूड का, क्योंकि वो जो पर्टिकुलर फूड है, वो हम जब खाना खाते हैं तो उससे हमारा ब्लड शुगर लेवल कितना इंक्रीज करता है, वो ग्लाइसेमिक इंडेक्स, उसको एक नाम दिया गया, साइंटिफिक नेम ग्लाइसेमिक इंडेक्स। जो लो ग्लाइसेमिक इंडेक्स वाले फूड होते हैं ना, उसको जब हम खाते हैं तो उसका हमारा ब्लड शुगर लेवल धीरे और बहुत कम अप होता है। लेकिन जब हम हाई ग्लाइसेमिक और जीआई इंडेक्स का फूड खाते हैं तो हमारा ब्लड शुगर लेवल सडन पीक करता है। ठीक है, चावल में बहुत सारी चीजें होती है, अच्छी होती है, उसके अंदर मिनरल्स की जो हम बात करते हैं, लॉजिक देते हैं, पर वो एक तो पहली बात है कि ब्राउन राइस, हम जो व्हाइट राइस खाते हैं, पॉलिश राइस खाते हैं, उसका जीआई बहुत हाई होता है, अबव 70 होता है, उसको खाते ही हमारा शुगर पीक करता है। हालांकि जीआई इंडेक्स जो हमारा गेहूं का भी होता है, पर गेहूं अगर हम होल ब्रांड व्हीट का, ये ब्रांड वाली व्हीट की रोटी खाते हैं तो उसका ग्लाइसेमिक इंडेक्स लो होता है और उसमें फाइबर कंटेंट ज्यादा होता है। तो यही एक रीजन है कि डॉक्टर चावल खाने से मना करते।
जो डायबिटिक हैं उनको डेंटल केयर के लिए, प्रिवेंटिव केयर के लिए क्या करते रहना चाहिए? डूज एंड डोंट्स क्या हैं?
जी, जो नॉर्मल एक हेल्दी पर्सन को करना चाहिए, डायबिटिक को भी वही करना चाहिए। यानी कि जैसे सुबह जो है दांतों की सफाई का ध्यान रखना सुबह, और रात को भी ब्रश करके सोना। तो ये कई लोग डायबिटीज हो चाहे नॉर्मल नॉन डायबिटिक हेल्दी हो, ये लोग रात को आलस कर जाते हैं कई। तो रात को ब्रश करना जरूरी है, क्योंकि रात भर अगर जो जूठा मुंह या फिर मुंह साफ नहीं रहता तो वो रात भर बैक्टीरिया उसमें और पनपते रहते हैं और उनकी वैरायटी और जो है घातक बन जाती है। तो सुबह ब्रश करें और रात को ब्रश करके सोए। तो ये मैं एडवाइस जरूर करूंगा। ब्रश के साथ साथ टंग क्लीनिंग यानी ना, और डेंटल फ्लॉस, ये 3 चीजें करने से जो है मुंह की सफाई का अच्छा ख्याल रखा जा सकता है।
आज के हेल्थनामा में इतना ही। अलग अलग बीमारियों पर डॉक्टरों की राय विस्तृत में जानने के लिए आप हमारे YouTube चैनल हील फाउंडेशन को सब्सक्राइब करें और देखें डॉक्टरों की क्या राय है अलग अलग बीमारियों पर। इसके अलावा सेहत पर विस्तृत चर्चा के लिए हर रविवार सुबह 8 से 11 बजे YouTube और Facebook पर जुड़ सकते हैं हमारे लाइव शो हेल्थ फॉर ऑल में। नमस्कार।
Welcome back. This show, Health for All, is live on Facebook and YouTube. We now have the session intro video before we move on to the last third session. The next segment on Health for All is on brain tumor diagnosis and management. A brain tumor is a mass of growth of abnormal cells in your brain. Many different types of brain tumors exist. Some brain tumors are benign or non-cancerous, while some are malignant and or cancerous. To speak about on this, we have an eminent panel consisting of Dr. Amitabh Gupta, who has 25 years of experience in dealing with various brain and spine disorders. He did his neurosurgical training from the Sri Chitra Tirunal Medical Sciences and Technology, Thiruvananthapuram. He also got trained at the National Institute of Mental Health and Sciences, or NIMHANS, in Bengaluru. He's an expert in various surgeries like complex brain tumors, clipping of aneurysms, AVMs, epilepsy, and deep brain stimulation, spine surgeries, endoscopic and minimally invasive surgeries, and trauma care. Next, we have Dr. Sonia Lal Gupta, the Director, Metro Group of Hospitals in Delhi. She's a US board certified neurologist with fellowship in headache medicine and vascular neurology. She graduated in 2011, becoming the youngest neurologist in the world at the age of 27. Next we have is Dr. Rohit Bansal, an expert in neurosurgery with more than 12 years experience in neurosurgery and spine surgery. He has been widely acknowledged for his versatile and patient-centric approach. Last but not the least, we have Dr. Soumya Mittal, who is a neurologist with 16 years of experience in neurology. He practices at Felix Hospital in Noida. Welcome all the speakers. Now I hand over this platform to my co-host for the first round of questions. Over to you, Kishore.
Thank you, sir. मेरा पहला सवाल डॉक्टर अमिताभ गुप्ता से है. डॉक्टर गुप्ता, हमारे दर्शकों को कुछ ब्रेन ट्यूमर के बेसिक्स के बारे में बताइए. ब्रेन ट्यूमर के सिम्टम्स क्या हैं, क्योंकि ज्यादातर मामले में देखा गया कि मरीज को जब पता चलता तब तक काफी देर हो चुकी होती है. तो इसके क्या सिम्टम्स हैं, कैसे वो समझे कि ये ब्रेन ट्यूमर ही है. आप अनम्यूट कर लिए सर.
आमतौर पे ब्रेन ट्यूमर जो हम मानते हैं वो एक एबनॉर्मल ग्रोथ है जो दिमाग में जो हमारे नॉर्मल सेल्स हैं, जो हमारी नॉर्मल कोशिकाएं हैं और सेल्स हैं, वो अपने आप में अनकंट्रोल बढ़ती जाती हैं, जिनके ऊपर कोई कंट्रोल नहीं रहा. तो इनके सिम्टम्स जो हमारे दिमाग में होते हैं वो मुख्य 3 या 4 हैं, जिनको हमें खास तौर पे ध्यान रखना चाहिए. और इसकी वजह ये है कि हमारा जो मस्तिष्क है, ये जो हमारे स्कल या खोपड़ी है उसके अंदर बंद है. तो ये एक तरीके से अपने एक छोटे से डिब्बे में बंद है. तो इसमें अगर कोई भी चीज बढ़ती या घटती है, उसी के अनुसार हमें उसके सिम्टम्स भी आते हैं. खास तौर पे सुबह उठ के भारी दर्द रहना या नींद खुल जाना दर्द के कारण, उसके साथ साथ उल्टी होना, उल्टी के बाद दर्द में कमी आना, और जो इसके अन्य सिम्टम्स में खास जो है वो है कि मिर्गी के दौरे पड़ना. मिर्गी का दौरा हालांकि ब्रेन के ट्यूमर की वजह से हार्डली 1 to 5% में होता है, पर ये ऐसी चीज है जिसको हम डायग्नोज करके ट्रीट कर सकते हैं. मतलब ये ट्रीटेबल मिर्गी का कारण हो सकता है. इसके साथ साथ आपको हाथ या पैर में कमजोरी आना, क्योंकि ये किसी भाग में, जिस भाग में ये ट्यूमर होता है उसके अनुसार ही हमें इसके लक्षण दिखते हैं. तो अगर ये उस भाग में है जिसमें हाथ या पैर का नियंत्रण है, तो आपको उसकी कमजोरी या फिर उसमें सुन्नपन महसूस होना, या फिर आपको चलने में दिक्कत होना, या आमतौर पे और कुछ नहीं तो सिर्फ चक्कर आना भी एक सिम्टम हो सकता है. तो ये कुछ ऐसे सिम्टम्स हैं जिनको आप नजरअंदाज कर सकते हैं अगर ये कम है या फिर 1 या 2 दिन के लिए है. पर ये अगर लगातार होते रहें और आप इनसे परेशान हैं, तो मेरी यही आपसे सलाह है कि आप तुरंत ही पास के अपने किसी भी नजदीकी डॉक्टर के पास जाइए, उसकी सलाह लें और उसी हिसाब से फिर आगे इसको ट्रीट कराएं, या इमेजिंग करा के जो हमें इसका रिपोर्ट मिलती है उसके हिसाब से हम इसको ट्रीट करें.
डॉक्टर साहब, जैसा आपने बताया, नॉर्मल ब्रेन सेल्स में क्या चेंजेस होते हैं जो ब्रेन ट्यूमर की ओर ले जाते हैं?
देखिए, जैसा मैंने आपको कहा, ये अनियंत्रित जो आपके सेल होते हैं या जिससे आपकी कोशिकाएं बनती हैं, उनका ये एकदम से बढ़ जाना, तो जो ये कारण है ये जेनेटिक होते हैं, अब मुख्य लोगों में तो ये जेनेटिक का एक ना एक कंपोनेंट किसी ना किसी में मिलता है, साथ में जैसे हम रेडिएशन बोलते हैं या फिर बिजली की सिकाई, ये भी एक कारण होता है। इसी के साथ साथ स्मोकिंग या फिर आप जो केमिकल्स होते हैं जो हम पेस्टिसाइड्स वगैरह में देखते हैं, ये भी उसका एक संयोजक कारण हो सकता है। पर मुख्य तौर पे अधिकतर ब्रेन ट्यूमर्स का कंपोनेंट जो होता है वो जेनेटिक है।
तो क्या मतलब सेल्स के डीएनए में भी कोई चेंजेस आते हैं?
जी हाँ, तो ये दो तरीके होते हैं, एक तो हम फैमिलियल कहें या पारिवारिक, कि पारिवारिक वो ट्यूमर हो सकता है अगर वो आपकी जीन आपके माता पिता या आपके ग्रैंड पेरेंट्स से मिली हो, या फिर आप ही में ये ट्यूमर डेवलप हो सकता है क्योंकि आपके बर्थ के बाद या आपके पैदा होने के समय या उसके बाद जो आपके डीएनए में चेंजेस आए हैं वो इसका कारण बन सकते हैं।
थैंक यू डॉक्टर साहब। हम आपके पास फिर लौटेंगे सेकेंड राउंड में। डॉक्टर सोनिया लाल गुप्ता, आप अनम्यूट कर लें। लगातार, जैसा कि डॉक्टर साहब ने बताया कि लगातार सिर दर्द हो तो डॉक्टर के पास जाना चाहिए। सिर दर्द के मामले में आप तो वैसे भी विशेषज्ञ रही हैं, पहले भी हम आपसे बात करते रहे। ये सिर दर्द ब्रेन ट्यूमर वाले सिर दर्द से अलग कैसे होता है? कैसे हम मरीज कैसे समझ पाए कि ये मामूली सिर दर्द नहीं है?
किशोर जी, ये बहुत जरूरी सवाल है। पहली चीज है कि जब सिर दर्द होता है तो एज अ डॉक्टर हम सवाल पूछते हैं कि किस तरह का सिर दर्द है, उसके साथ क्या क्या सिम्टम्स हैं। लेकिन जैसे कि कोई हो जिसको कभी पहले इतना सिर दर्द ना हुआ हो या इतना सिर दर्द ना, और एकदम अब सडनली ज्यादा सिर दर्द होने लग जाए, ब्लरी विजन या देखने में थोड़ी सी मतलब विजन बिल्कुल क्लियर ना हो, उल्टी आना, या जब खांसते हैं तो सिर दर्द का बहुत ज्यादा बढ़ जाना, वो कुछ ऐसे लक्षण होते हैं कि शायद प्रेशर ब्रेन के अंदर बढ़ रहा है। जैसे डॉक्टर अमिताभ गुप्ता ने कहा, हमारा ब्रेन एक डब्बे की तरह है, एक क्लोज डब्बे की तरह जो बहुत टाइटली क्लोज्ड है, जो खुल नहीं सकता। तो अगर उसके अंदर प्रेशर बढ़ेगा तो दर्द होगा। तो वो जब हम प्रेशर बढ़ता है तो उस तरह का सिर दर्द में तो लोगों को ये ध्यान देना है कि अगर हेडेक के साथ ब्लरी विजन हो रही है, अनकंट्रोल्ड वॉमिटिंग हो रही है, खांसी करने पर एकदम सिर दर्द ज्यादा हो रहा है, प्रेशर देने पर सिर दर्द ज्यादा हो रहा है, तो उनको जाके डॉक्टर से डेफिनेटली बात करनी चाहिए। या कभी किसी को सिर दर्द हुआ ही नहीं एंड सडनली अब उनको सिर दर्द रहने लग गया है, वो भी एक साइन हो सकता है कि हो सकता है कुछ अंडरलाइन हमें रूल आउट करना जरूरी है। तो ऐसी सिचुएशन में पहले डॉक्टर हिस्ट्री लेगा एंड उसके बाद वो डिटर्मिन करेगा, एमआरआई करके रूल आउट किया जा सकता है, एमआरआई ब्रेन करके कि कुछ ट्यूमर है या नहीं।
आपने जैसे बताया कि लॉस ऑफ विजन होने लगता है, क्या लॉस ऑफ स्मेल भी होता है?
लॉस ऑफ स्मेल डिपेंडिंग ऑन क्या लोकेशन है। अगर हेडेक जिस तरीके की जहाँ पे ट्यूमर की लोकेशन है उसके अकॉर्डिंगली, अगर वो इस एरिया के पास है जहाँ पे ऑल्फैक्टरी नर्व्स है, जो नर्व जहाँ से हमारी स्मेल आती है, तो लॉस ऑफ स्मेल भी हो सकता है। अगर वो उस जगह के पास है जहाँ पे हमारी विजन की नर्व्स हैं तो ब्लरी विजन या लॉस ऑफ विजन होगा। अगर ऐसी जगह पे है जहाँ पे प्रेशर बहुत पड़ रहा है तो फिर अलग तरह का सिम्टम होगा। तो उस पर डिपेंड करता है। कॉमनैलिटी होती है कि हेडेक हो रहा है और प्रेशर से रिलेटेड है।
डॉक्टर सोनिया, एक सवाल बार बार पूछा जाता है कि क्या माइग्रेन पेन आगे चलकर ब्रेन ट्यूमर हो सकता है?
बिल्कुल भी नहीं, ऐसा कोई कनेक्शन है ही नहीं। माइग्रेन कंप्लीटली एक डिफरेंट एंटिटी है, एक तरीके से न्यूरोकेमिकल एंटिटी है, जबकि ब्रेन ट्यूमर अनकंट्रोल्ड सेल्स, जो सेल्स हैं वो अनकंट्रोल्ड तरीके से बढ़ रहे होते हैं। तो बहुत दोनों बिल्कुल अलग चीजें हैं और कोई कनेक्शन नहीं।
थैंक यू डॉक्टर सोनिया, बने रहिए। अगले राउंड में फिर मिस्टर शंकर आएंगे आपके पास। डॉक्टर रोहित बंसल, आपसे मेरा सवाल यह है कि क्या डिप्रेशन और मूड स्विंग भी ब्रेन ट्यूमर के लक्षण होते हैं, और अगर हाँ तो ये किन मामलों में होता है? क्या सभी में होता है?
जी नमस्कार। जैसे कि डॉक्टर अमिताभ और डॉक्टर सोनिया ने बताया कि ब्रेन ट्यूमर के जो सिम्टमेटोलॉजी है, जो ब्रेन ट्यूमर के लक्षण हैं, वो ट्यूमर की लोकेशन पे डिपेंडेंट होते हैं। तो ब्रेन में हर एरिया का एक स्पेसिफिक फंक्शन है, हर नर्व का एक स्पेसिफिक फंक्शन है। तो ब्रेन के कुछ एरियाज ऐसे होते हैं जो जाके, जैसे कि फ्रंटल लोब जो आगे की तरफ का हिस्सा होता है ब्रेन का हमारे, वो इंसान की पर्सनैलिटी और ये सब चीज़ें कंट्रोल करता है। तो यदि कोई ट्यूमर लोकेटेड होता है फ्रंटल लोब के अंदर, तो पर्सनालिटी चेंजेस, डिप्रेशन, मूड स्विंग्स, इस प्रकार के सिम्टम्स भी आना पॉसिबल है, होते हैं, इस प्रकार के सिम्टम भी एसोसिएटेड होते हैं।
डॉक्टर साहब, आप न्यूरोसर्जन भी हैं, अक्सर ये सवाल पूछा जाता है कि क्या ब्रेन ट्यूमर का कंप्लीट क्योर संभव है, और सबसे ज्यादा सवाल ये पूछा जाता है कि इसकी सर्जरी का सक्सेस रेट क्या है, क्योंकि लोग ये मानते हैं कि बहुत सक्सेस रेट बहुत अच्छा नहीं है।
देखिए, पहली चीज तो मैं ये बताना चाहूंगा कि ब्रेन ट्यूमर्स दो प्रकार के होते हैं, नॉन कैंसरस और कैंसरस। जो नॉन कैंसरस ट्यूमर होते हैं, जिसको बिनाइन ट्यूमर भी कहा जाता है, उसकी परसेंटेज जो होती है वो 65 to 70% होती है। केवल 25 से 30% केसेस ऐसे होते हैं जो कैंसर होते हैं, मैलिग्नेंट होते हैं। सो आजकल क्या है, टेक्नोलॉजी और एक्सपर्टीज और सर्जिकल रिसेक्शन इतना सेफ हो गया है कि जो बिनाइन केसेस होते हैं पर्टिकुलरली, यदि उनको हम पूरी तरह से सर्जरी करके रिमूव कर दें तो दैट इज कंसिडर्ड एज अ क्योर फॉर लाइफ। हमें आगे उसकी कुछ करने की आवश्यकता ही नहीं है। हाउएवर, अगर कैंसरस ट्यूमर होते हैं, जैसे कि जिसको हम मैलिग्नेंट ट्यूमर्स बोलते हैं, उन केसेस के अंदर भी सर्जिकल रिसेक्शन बहुत सेफ है और 95 to 98% केसेस के अंदर कोई कॉम्प्लिकेशन नहीं आती।
तो ये कैंसरस कब होता है? क्या नॉर्मल ब्रेन ट्यूमर कैंसरस हो जाता है, कैंसर हो जाता है?
देखिए, जैसे हमने बताया कि ट्यूमर एक बेसिकली बहुत ब्रॉड टर्म है, बहुत ब्रॉड टर्म है, जिसको हम बोलते हैं कोई भी एबनॉर्मल सेल इकट्ठा हो गया उसको हम ट्यूमर बोल देते हैं। तो नॉर्मली क्या होता है कि जब हम सर्जरी के लिए किसी पेशेंट को प्लान करते हैं, जब सर्जरी करके ट्यूमर को रिमूव कर दिया जाता है, तो उस ट्यूमर की गांठ को हम लोग टेस्ट के लिए भेजते हैं, इसको हम बायोप्सी बोलते हैं। सो बायोप्सी बेसिकली कंफर्म करती है कि ट्यूमर वो कैंसर है कि नॉन कैंसर है। सो इट इज अ हिस्टोपैथोलॉजिकल डायग्नोसिस। जो कैंसर है दैट इज अ हिस्टोपैथोलॉजिकल डायग्नोसिस।
डॉक्टर साहब, इसी से जुड़ा एक सवाल है, ये स्पाइनल कॉर्ड ट्यूमर क्या होता है? क्या इसके सिम्टम भी एक जैसे होते हैं?
जी, जिस प्रकार ब्रेन में नसें होती हैं उसी प्रकार स्पाइनल कॉर्ड भी एक ग्रुप ऑफ नर्व्स है, बेसिकली एक कलेक्शन ऑफ नर्व्स एंड न्यूरल टिश्यू है। सो जिस प्रकार से एबनॉर्मल टिश्यूज हमारे ब्रेन में इकट्ठे हो जाते हैं, उसी प्रकार से एबनॉर्मल टिश्यू हमारे स्पाइनल कॉर्ड के अंदर भी इकट्ठे हो जाते हैं। सो स्पाइनल ट्यूमर हम उसको बोलते हैं जो एक ट्यूमर टिश्यू वहां पे इकट्ठा हो जाता है।
ठीक है डॉक्टर साहब, आप बने रहिए हमारे साथ, सेकेंड राउंड में फिर आपसे बात करेंगे। और चूंकि हमें बताया गया कि आप जल्दी जाएंगे तो शुरू में ही सेकेंड राउंड में आपसे बात होगी।
थैंक यू सर।
डॉक्टर सौम्य मित्तल, क्या ब्रेन ट्यूमर की वजह से मरीज की पर्सनैलिटी में चेंजेस आते हैं, और आते हैं तो किस तरह के चेंजेस आते हैं?
बहुत अच्छा सवाल है आपका। देखिए, इसमें दो पार्ट्स में हम इसको ले सकते हैं। सबसे पहली बात जो अभी तक हमारे सारे पैनलिस्ट ने बोली है कि इसमें बहुत इंपॉर्टेंट बात है कि आपका जो ट्यूमर है वो किस जगह लोकेटेड है। तो बहुत सारे जो ब्रेन के पार्ट्स हैं जो पर्सनालिटी को अफेक्ट करते हैं, अगर हमारा ब्रेन वहाँ ट्यूमर जो है वो उस लोकेशन में बैठा हुआ है, डेफिनेटली हमारी पर्सनालिटी पे फर्क पड़ सकता है। दूसरी चीज, जो डिप्रेशन है, जो आपके पेशेंट की एंजाइटी है, इसी बात को लेके कि हमारे पेशेंट को ट्यूमर है, हमारे पेशेंट को ब्रेन ट्यूमर है, क्या होगा आगे, क्या इलाज होगा, क्या उसकी रिस्पॉन्स भी उसको प्रॉब्लम देगी, वो चीज भी को इफेक्ट करेगी। तो वो चीज डेफिनेटली, दोनों चीजें मिला के डेफिनेटली पेशेंट की पर्सनालिटी में फर्क पड़ सकता है।
डॉक्टर साहब, क्या ब्रेन ट्यूमर का ओबेसिटी और लाइफस्टाइल से भी कोई रिलेशन है?
बहुत ज्यादा इसमें मैं नहीं मानता कि बहुत फर्क पड़ता है, बट यस डेफिनेटली जेनेटिक्स है। जेनेटिक्स में हमारी दोनों चीजें रिलेटेड आ सकती हैं, बट डायरेक्टली अगर हम बोलेंगे कि हाँ ओबेसिटी से फर्क है तो उतना ज्यादा रिस्पॉन्स नहीं है।
एक सवाल और डॉक्टर साहब, कहीं मैंने पढ़ा था कि महिलाओं के केस में सिम्टम्स कुछ अलग तरह के, कुछ एडिशनल भी होते हैं, जैसे एक्सेसिव बॉडी हेयर होता है, लैक ऑफ मेंस्ट्रुएशन होता है, ऐसा क्यों?
देखिए, जो ट्यूमर है वो अपने केमिकल्स रिलीज करता है। दूसरी चीज, ट्यूमर जैसे है वो कौन से पार्ट से आया है, प्राइमरी ब्रेन का ट्यूमर है कि बॉडी के अलग अलग पार्ट्स भी इन्वॉल्व हैं, तो ये सब लेके हार्मोनल इम्बैलेंस कर सकते हैं, जिसकी वजह से भी ये प्रॉब्लम आ सकती है। फिर कौन से हिस्से का ट्यूमर है, एक मेन हमारी ग्रंथि होती है जिसको हम बोलते हैं पिट्यूटरी ग्लैंड, वहां का अगर ट्यूमर है तो वो भी आपके सारे हार्मोनल कंट्रोल पूरा पिट्यूटरी ग्लैंड में बैठा होता है, वहां से भी आपके सारे हार्मोन कंट्रोल आ सकते हैं। तो डेफिनेटली अगर वहां पे है तो वो भी हार्मोनल चेंजेस ला सकता है।
डॉक्टर साहब, एक बात और कही जाती है, एक सवाल कि फ्रीक्वेंट एक्सपोजर ऑफ एक्सरे, अल्ट्रासाउंड, सिटी स्कैन्स, यहाँ तक कि यूज ऑफ मोबाइल फोन, ये सब भी ब्रेन ट्यूमर के कारण हो सकते हैं। ये मिथ है या इसमें सच्चाई है?
देखिए, रेडिएशन जो है वो अपने आप में एक रिस्क है ट्यूमर्स का, ये नोन फैक्ट है। मोबाइल्स के बारे में ये कहेंगे कि मोबाइल्स के बारे में पहले आया है कि दे कैन अफेक्ट, पर कॉन्ट्राडिक्टरी रिपोर्ट्स भी हमारे पास है कि कोई ऐसा एविडेंस 100% नहीं है। तो पर रेडिएशन, यस डेफिनेटली, अननेसेसरी सीटी, अननेसेसरी एक्सरे करना बिल्कुल वाजिब नहीं है, बिल्कुल सपोर्टेड नहीं है।
थैंक यू डॉक्टर साहब। आपसे बात करेंगे मिस्टर शंकर। ओवर टू यू मिस्टर शंकर। अनम्यूट कर ले सर, प्लीज अनम्यूट योरसेल्फ।
Since Dr. Rohit has to leave early, I'll start with you, Dr. Rohit. What are the typical spinal cord disorders that you see in India?
See, there are plenty of spinal cord disorders that are presently that we commonly encounter in the country. It can range from degenerative. First of all, there's a degenerative pathology. एक हम बोलते हैं degenerative pathology. Degenerative pathology का मतलब क्या होता है कि एज के साथ स्पाइन के अंदर चेंजेस आने शुरू हो जाते हैं, बोन्स वीक हो जाती हैं, डिस्क हर्निएशन हो जाती है, कैनाल स्टेनोसिस होता है, नसों पे प्रेशर आना शुरू होता है, उसको हम बोलते हैं degenerative changes. That is one pathology. सेकेंड पैथोलॉजी आती है स्पाइन की ट्यूमर्स की। थर्ड पैथोलॉजी आती है ट्रॉमा की, यानी कि स्पाइन में रीढ़ की हड्डी में चोट लग जाने की। चौथी पैथोलॉजी आती है स्पाइन की जो नसें होती हैं, ब्लड वेसल्स होती हैं, उसका एबनॉर्मल कलेक्शन, एबनॉर्मल बंच, जिसको हम वैस्कुलर मैलफॉर्मेशन बोलते हैं, उसकी। और पांचवी टाइप की कैटेगरी होती है हमारी कंजेनेटल, यानी कि बाय बर्थ डिफेक्ट्स जो स्पाइनल कॉर्ड में होते हैं। कई बच्चों की स्पाइनल की हड्डी स्प्लिट होती है, पीछे से नसें वहां से बाहर निकल रही होती हैं, उसको हम डेवलपमेंटल प्रॉब्लम बोलते हैं। तो ये 5 ब्रॉड कैटेगरीज है स्पाइन प्रॉब्लम्स की, जो हम लोग कॉमनली एनकाउंटर करते हैं ओपीडी के अंदर।
What are the treatment options for all these 5? Is it surgery alone, or do you have other treatment options also?
Yes, so depending upon the condition, depending upon the pathology, depending upon the problem and the nature of the symptoms, treatment initiate किया जाता है. So like I said, if you say majority of the patients जो spine
I think it is a net problem for Dr. Rohit. I think we lost his connection. We will move on to him later on. I will come to Dr. Amitabh Gupta. Now, how exactly would you describe?
I'm sorry.
Sorry, you can continue. Yes, you can continue. We lost you in between. There was a connectivity problem.
Yeah, you're right. So, like I was telling you that the most common problem that we encounter in the clinic is the degenerative problems. जैसे कि डिस्क हर्निएशन हो गया या हड्डियां वीक हो गई हैं, तो मेजॉरिटी ऑफ केसेस में इनिशियल ट्रीटमेंट स्टार्ट किया जाता है फिजियोथेरेपी से एंड मेडिकेशंस के साथ, एंड 60 to 70% ऑफ द पेशेंट्स बेनिफिट फ्रॉम फिजियोथेरेपी एंड मेडिकेशंस अलोन। हाउएवर, कुछ केसेस में जहां पे नर्व कंप्रेशन बहुत सिग्निफिकेंट होता है या फिजियोथेरेपी से रिलीफ नहीं मिलता, उन केसेस के अंदर हमें सर्जरी करनी पड़ती है। डिस्केक्टमी हो गई, लैमिनेक्टमी हो गई। So that surgery gives an instant benefit, very, very good relief. And however, if you speak about the tumor, like I said, कि treatment is depending upon the nature of pathology. अगर किसी पेशेंट को ट्यूमर डायग्नोज होता है, तो ट्यूमर का essentially treatment is surgical removal. ट्यूमर्स के केस में ट्यूमर सर्जरी ही करी जाती है।
So speaking of brain tumor segmentation provides useful information for diagnosis and treatment planning. However, it is still a challenging task due to the irregular form and confusing boundaries of tumors. What's your comment on this?
Absolutely. Like I said, that in brain, every millimeter is very, very important. So, that is where the role of technology comes into play. So there are advanced diagnostic modalities available these days, like functional MRI. Then during this surgery, we have a lot of technology like neuronavigation and intraoperative cortical mapping, intraoperative ultrasound. So all these technologies are basically put to use when you plan the patient for the surgery. And these help you pinpoint the exact location of the tumor in the brain and help you, in very surgically precise surgical excision without damaging the adjoining brain tissue, normal brain tissue.
Yeah, and now awake brain mapping is the most precise way to identify and protect critical brain regions during removal of a tumor. Patients may need this procedure if their tumors are located near language, motor, or sensory regions of the brain. What's your take on this?
Absolutely. Like I said, that the intraoperative technology like cortical mapping is one of the most importantly applied technology for mapping the very, very vital areas of the brain. So basically, during this surgery, we place electrodes on the brain and try to map out which area and which part of the brain is basically responsible for your speech, which area is responsible for your leg movements, which area is, all the vital areas are basically mapped and sidelined. And the relation of the tumor to those vital areas is very clearly identified. So that when you do the surgery for the tumor, you're basically just removing the tumor and not damaging those normal areas. So it's a boon.
Yeah, so a lot of times we read in the newspapers and it makes a very splashy headlines that surgery was conducted on a brain surgery, rather skull surgery was done on a patient who was awake and he was playing flute or he was doing this or he was doing that. What exactly is that?
Yes, awake craniotomy again is a very beautiful and a very challenging surgery. The surgery is called awake craniotomy. When while the surgeon is operating upon the brain of the patient is basically awake. So what happens is that you initially begin with the anesthesia and you open the skull, and when you reach the tumor, you basically just dose off the anesthesia and make the patient awake. And good analgesia and good painkillers are given at that point of time. And then basically during the surgery, while you're removing the tumor, you ask the patient to lift their hand or speak something so that while removing the tumor, you know that you're just removing the abnormal part, you're not removing the normal part. Because while removing, even if you touch the normal part during the surgery, that movement of one side of the body or movement of the speech might get affected, and you would know that yes, you're in the normal area. So that part of the brain should be not be removed.
Do some patients get very alarmed or excited or sort of nervous at such point of time?
Absolutely. You're very right. This is a very good question because obviously the thought of operating upon the brain and you're sitting awake and playing flute or talking to the doctor is it can give goosebumps to anybody, even the surgeons. Yeah. So before this surgery, of course, there is a counseling session which is held with the patient, and they are explained in detail the whole procedure, and they're even shown the videos so that the apprehension is taken off. And only when the patient gives a consent to go ahead with the procedure, only then the things are done taken forward.
Thank you very much, Dr. Rohit. Thank you for the wonderful answers that you have just given. And I will now move on to Dr. Gupta. Dr. Gupta, how exactly we would describe tumors and a complex brain tumor? What's the difference?
See, a simple tumor is where it is easily, मतलब जहाँ आराम से आप उसको निकाल सकते हैं. That can be on the surface of the brain or the skull. कि आप उसको जैसे ही आपने खोपड़ी का थोड़ा भाग खुला, वहीं आपको ट्यूमर मिल गया. दूसरी बात ये है कि वो आपके जो खास एरियाज होते हैं, इंपॉर्टेंट एरियाज जो होते हैं, जहाँ पे स्पीच, आपका बिहेवियर, आपका बर्ताव या आपका सोशल परफॉर्मेंस या आपकी जो नसें हैं, लाइक ऑप्टिक नर्व या आंख दिखाई देने वाली या पीछे की जो नर्व्स हैं खाने वाली, उनसे दूर है. जो कॉम्प्लेक्स ब्रेन ट्यूमर होता है वो एक ही जगह से 3 या 4 पार्ट में हो सकता है. हमारे जो हम मोटे तौर पे कहते हैं, हमारा एक बड़ा मस्तिष्क है और एक छोटा मस्तिष्क है, बिग ब्रेन एंड अ स्मॉल ब्रेन. स्मॉल ब्रेन इज आल्सो कॉल्ड एज द हाइंड ब्रेन, जो पीछे होता है. तो अगर कोई ट्यूमर आगे से पीछे तक जा रहा है या पीछे से आगे तक आ रहा है और जो कई सारी नसों को अपने अंदर जकड़ा हुआ है, नसों के साथ साथ वो ब्लड वेसल्स को भी जकड़ा हुआ है, तो इट्स ए कॉम्प्लेक्स ट्यूमर. क्योंकि उसको निकालना एक स्टेज, जो हम कहते हैं स्टेजिंग प्रोसीजर में निकाला जाता है. एक पर्टिकुलर स्टेज में अगर आप सिंगल स्टेज में निकालने की कोशिश करेंगे तो हो सकता है कि देयर माइट बी ए डैमेज टू द स्ट्रक्चर विच इज इंपॉर्टेंट टू द पेशेंट. So these kind of tumors which require previous kind of a thought process, it's a multidisciplinary team, जिसमें there can be involvement of a even plastic surgeon. where you need to take a flap. You want to remove a large area of a flap of a skull and then reconstruct it. So, and it also depends if the tumor is going out, बाहर जा रहा है, अंदर से बाहर निकल के आ रहा है, तो ये भी एक कॉम्प्लेक्स ट्यूमर की परिभाषा में आता है या उसकी डेफिनेशन में आता है.
So what exactly is brain stimulation and when is it used?
Can you repeat that?
What exactly is brain stimulation and what is it used for?
जो ब्रेन स्टिमुलेशन या जो हम कहते हैं उसको हम एक स्मॉल, जैसे आपने देखा होगा हमें कभी करंट लगता है अचानक तो हम झटका मारते हैं, लाइक वी गिव ए शॉक टू आवर हैंड, तो इट्स ए रिफ्लेक्स मैकेनिज्म. सिमिलरली वी गिव ए स्मॉल, छोटे अमाउंट में जो करंट होता है विच इज जस्ट टू स्टिमुलेट ए एरिया और ए पोर्शन ऑफ ए ब्रेन. तो ये ट्यूमर के आसपास, अगर मान लीजिए ट्यूमर ऐसी जगह है जहां आपके खास इलाके हैं जिसमें कि आपका स्पीच है, आपका मेमोरी है, आपका बिहेवियर थेरेपी है, आपका बिहेवियर के साथ साथ विजन एरिया है, या फिर आपका एनी लाइक नियर द ब्रेन स्टेम में आपके जो एक छोटा सा एरिया, लाइक 1 मिलीमीटर एरिया में आपका सभी कुछ होता है. तो ऐसी जगह पे जब आपका अगर मान लीजिए ट्यूमर है या फिर कैंसर है, तो यू हैव टू बी वेरी केयरफुल, क्योंकि आप अगर 1 मिलीमीटर भी ट्यूमर के बाहर चले गए तो आप बहुत बड़ा नुकसान कर सकते हैं पेशेंट का. तो उसके लिए हम लोग ट्यूमर के आसपास एक छोटी सी इलेक्ट्रोड्स होते हैं या आप कह दीजिए नीडल होती हैं, जिनको हम टच करते हैं सरफेस ऑफ द ब्रेन को, और जब हम उसे टच करते हैं तो हमें वो, जैसे आप बात कर रहे थे अवेक क्रेनियोटमी की, तो पेशेंट उस समय हम कोशिश करते हैं अवेक हो, वो जगा हुआ हो, क्योंकि उसका रिस्पॉन्स भी उसी के बेसिस पे दिखाई देता है कि वो बात करते हुए क्या वो बात में अटक गया, या उसके विजन में कोई दिक्कत आ गई अगर हमने टच किया, या फिर उसको जो हम शब्द कह रहे हैं उसको समझने में दिक्कत आ रही है. तो ये सारी चीजें हम ट्यूमर के आसपास एक तरीके से स्टिमुलेट करके एक मैप बना लेते हैं कि भाई इस इलाके के अंदर या इस सर्कमफ्रेंस के अंदर ट्यूमर है, इसके बाहर अगर आप जाएंगे तो पेशेंट का आप नुकसान कर सकते हैं या उसको कोई डेफिसिट या कमजोरी आ सकती है. तो दिस इज नोन एज स्टिमुलेशन एंड ब्रेन मैपिंग.
Like what happens is like clipping of aneurysms. Can you also clip blood supplying vessels to tumor in the brain, or do you prefer removing the entire tumor if it is not malignant?
आपने बहुत अच्छी चीज पूछी. That's a good question. कि if there are large tumors, बहुत बड़े tumors होते हैं, where the blood supply they have a particular blood vessel going to it. तो अगर such kind of tumors are there where we know they are very vascular, मतलब वो खून वाले ट्यूमर्स हैं या खून वाले गांठ हैं, तो हम उनका पहले से एंजियोग्राफी करते हैं. एंजियोग्राफी में इफ वी सी कि देयर इज ए ब्लड वेसल जो पर्टिकुलरली जा रही है, एक मोटी ब्लड वेसल, तो हम उसको पहले से बंद कर देते हैं, ब्लॉक करते हैं, जिसे हम कहते हैं एम्बोलाइजेशन. तो ये प्रोसीजर भी किया जाता है और उसको करके हम उसकी ट्यूमर की ब्लड सप्लाई कट ऑफ कर पाते हैं. पर इसका मतलब ये नहीं है कि आप ट्यूमर को छोड़ दें कि ट्यूमर मर जाएगा. उसके बावजूद भी आपको ट्यूमर निकालना पड़ता है, और ऐसा भी नहीं कि आप बहुत लंबे समय तक वेट कर सकते हैं. तो इट इज काइंड ऑफ ए स्टेज प्रोसीजर अगेन, एज आई वाज टॉकिंग अबाउट इन कॉम्प्लेक्स ट्यूमर्स. तो ये उसमें एक स्टेजिंग प्रोसीजर हो जाता है और उसको फिर हम ऑपरेशन के लिए लेते हैं ताकि हमें उसमें ब्लड लॉस कम हो, हमारे को आसानी हो जाए ट्यूमर निकालने की, और इतनी परेशानी ना हो जो कि हमें ब्लीडिंग के द्वारा ब्रेन में हो पाती है.
And what is exactly cancer ablation?
कैंसर एब्लेशन एक तरीके का जो हम कहते हैं कि इफ यू गिव ए थेरेपी विच कैन एब्लेट द कैंसर, जो आज नई तकनीकें आ रही हैं जिसमें आप लेजर आप कह सकते हैं, देयर आर आल्सो सम जो कीमोथेरेपी बोलते हैं, कीमोथेरेपेटिक एजेंट्स हैं, उसके थ्रू आप कोशिश करते हैं ट्यूमर एब्लेट करने की. ये मोर कॉमन इन स्पाइनल ट्यूमर्स हैं, स्पेशली बोन ट्यूमर्स, मतलब रीढ़ की हड्डी के जो ट्यूमर हैं उनको आप एब्लेट करना थोड़ा इजी होता है. ब्रेन में एब्लेशन करना इसलिए दिक्कत है कि आप अगर उसको एक लिमिटेड उसमें नहीं रखेंगे ट्यूमर के अंदर, तो वो जो नॉर्मल आपकी टिश्यू है वो डैमेज हो जाएगी. और ब्रेन में जैसे कि बात कर रहे थे बाकी पैनलिस्ट भी, कि अगर छोटा सा एरिया भी डैमेज होता है तो उसका आपको बहुत बड़ा आपको नुकसान हो सकता है पेशेंट को, और डेफिसिट आ सकता है, मतलब कमजोरी आ सकती है या इवन लकवा आ सकता है. तो ये चीज मोस्टली ट्यूमर एब्लेशन कॉमनली किया जाता है स्पाइनल मेटास्टेसिस में, जो कि हम कहते हैं कि जिसमें आपके कैंसर आके स्पाइनल इसमें रीढ़ की हड्डी में बैठ जाता है, लाइक वर्टिब्रा, और उसको हम एब्लेट कर पाते हैं, जिसको हम कहते हैं आइदर बाय हीट और बाय कीमोथेरेपी.
You are speaking of precision. Now, in cancer ablation, computed tomography, ultrasound, or magnetic resonance imaging are widely used to guide and position the needle probe into the tumor. Now, are artificial intelligence tools also being used for this?
देखिए, artificial intelligence is being used, especially like what you call as robotics. But unfortunately, they are as of now used for functional neurosurgery. कि जब आप, जैसे आपने कहा, एक electrode को you have to take in a precise in a particular point in the brain, or for biopsy of that lesion. So that is being done with the help of robotics. But unfortunately, still, because brain, जैसा हम बात कर रहे थे, it's a very limited space. बहुत छोटा space है. You don't have much of a maneuverability of your area to maneuver there. Just like अगर हम देखें कि robotics in abdomen, जो हम कहते हैं robotic surgery in case of laparoscopy is very, very now the kind of a surgery which is happening in most of the hospitals. But as far as the brain is concerned, this is still very, very limited. क्योंकि अभी भी हमें वो जो maneuverability है, बहुत small areas में हमें दिक्कत आती है. So probably it is going to happen in near future. But as of now, the robotics are being used only for, as you said, putting a needle, doing a kind of a lesion there, या फिर even what you call as a focus ultrasound, where we do a lesion for functional neurosurgery, जिसमें कि आप दिमाग को या ब्रेन को खोलना भी नहीं पड़ता है. Unfortunately, जो focus ultrasound है, वो अभी इंडिया में हमें available नहीं. It is not available in India as a therapy. It has been approved by FDA in US recently only, 2-3 years back only. So this is something which is upcoming, and it will definitely going to happen in India very soon. And as far as the robotics are concerned, that will take a little more time, especially in brain.
We have a question. It might sound a bit simple or silly, but we have a question from from Navdeep, who's asking this, that, in the human body, we have been able to transplant almost all the organs except the brain. Now, one day, will this also be possible?
I think he has asked a very, very, what you call as a challenging question. But yes, people are working on it. अभी भी animal transplant पे they are working on it. Unfortunately, हमारी दिक्कत ये आती है कि when you cut the brain and try to transplant it, we cannot regenerate the connections. So when you can regenerate those connections to the lower part of the spinal cord, then probably this might be the therapy which will going to be, most likely it is going to happen, because what we call as nanotechnology. Nanotechnology has come up with small tubes, fine tubes, जिसमें आप nerves को regrow कर सकते हैं. But as I said, कि as of now, we cannot regenerate nerves after cutting it. तो अगर आपने पेड़ का तना काट दिया है, तो definitely ऊपर का पेड़ पूरा सूख जाएगा, और आप उसको फिर से जोड़ सकते हैं, which is available for at least the trees to some extent. I'm not saying all the trees. So similarly for the brain, it is very, very tough, because वो नसें जोड़ना ही, it is not millions, it is in billions. So connections is like in billions. So we don't know how to connect those billions in the correct way. So till you get that kind of a procedure, or you get that kind of a technology where you can connect each nerve to that particular nerve in the lower part, मेरे ख्याल से अभी transplant is quite a long way ahead.
So assuming that one day it really happens, and what will be your guess? How will that person think?
You're talking in the terms of the body, or you're talking in the terms of the patient?
No, from the patient. Suppose a transplant does happen, will the person think as the original person, or the person from whom the brain has been taken?
That is again something which is very, very challenging, because I think that thing has not been performed. But yes, I think there will be issues which will be concerning with that particular, when you transplant, because that means you are not in your own self or a body. So first of all, coming to challenge with the emotional part of it, then also, as you said, ki lower part has some areas where they kind of reflects back on the higher brain. So they may affect you how you think. But I think the major thing is that your cognitive or the intelligent function, which has been there in your brain as a normal person, will remain the same as compared to wherever you transplant it. So it will be like a continuation of the person itself.
Thank you. That was very interesting. I only hope they don't have a dual personality when it really happens.
Yeah, that's true. Very true.
Thank you. Thank you very much. Before I move on to Dr. Sonia, we'll just play a short video on wellness. I request the admin to play the video. Tell me exactly what is body shaming.
So anything like these days, too fat, too skinny, too short, too tall, too anything. There's a sense that we are all too something and we are all not enough. And mostly it's about our body. It is about these, small things that we, conceive from the environment, social media. I just lost 10 kgs of weight and this is how I lost it. Or, especially the social media or Instagram and Instagram influencers coming up with, these perfect lives, leading to a lot of self-doubt about your own body.
Welcome back and welcome Dr. Sonia. Wonderful having you again on our platform. Now, Dr. Sonia, artificial intelligence powered detection tool, which uses differential scanning fluorometry of blood samples, has shown to detect glioblastoma in patients with a 92% accuracy. As such technology advances, blood markers may feasibly be used to risk stratifying brain tumor patients and guide management. What is your comment on this?
Thank you for having me, Shankarji. Great to see you again. And this is a very interesting question because there's a term called liquid biopsy, where basically now people are taking blood samples, and the theory is that can we diagnose the tendency, if the tumor is actually coming, and we can diagnose the tumor. Now, this is something very early. It's, I think, in very early stages. Artificial intelligence will play a role, no doubt. And I think, as Dr. Amita rightly said, as we go forward, definitely it's going to be a very big tool that we all are going to use. At this time, I think when we see a lot of things come into the diagnosis, when we see the symptoms, we see the MRI, we see the location. A lot of clinical features that we see even on the MRI can help give an idea. But at the end of the day, it's going to be biopsy. Now, if we will have the tools that can help determine it, yes, it's going to be very useful. So there are, I think, studies going on at this time. And in the US, I know, and in Europe, a lot of places are using it, where they're using it to determine, the diagnosis. But glioblastoma is a big diagnosis, no doubt. So I think going forward, these tools are going to be very useful. And let's see when they happen. I mean, when they come on and when we can actually use it. Because I always think when it comes to India, something even as simple as focused ultrasound, we still don't have. There are a lot of technologies that come later on in India. So when we actually have the availability, when we as physicians, we start using them, then our experience is different. Then we'll see how the response is in India. A lot of the countries where they do these studies, they're based on Caucasian populations, they're different kind of cultures, populations. And so I think when the technology comes to India, when we actively start using it more frequently, depending on the cost and everything else, we'll have more data on how it can help our patients.
Yeah, but as you say, probably as we emerge, but India has got an advantage because this is all basically building algorithms and also sort of machine learning, where you need computational technology, and we have an advantage there. Probably we might catch up, we might leapfrog from what the technology has been from the West, and we have a lot of these startups who are doing wonderful work in AI and healthcare. Now, my next question is, can you use artificial, see, headaches are of many types, you have migraine, you have this headache, that. Can you use artificial intelligence to grade headaches?
So pain is something that is very difficult to grade because right now we don't have anything that can measure pain. I think so. First thing is when somebody has a headache, what is the intensity, of the headache the person is having? I think based on artificial intelligence, we can put in algorithms. I'll give you an example, right? Like let's take a migraine. Now, if we were to put in algorithms that if somebody has a headache, is it unilateral, bilateral? What type of the headache is it? Is it throbbing? Is it a dull headache? Then based on that, is there nausea present? Do they have vomiting as well? Is there light sensitivity, noise sensitivity present? How long does the headache last? So based on multiple symptoms and clinical features of the headache, we can make algorithms that can probably help identify maybe the type of headache. But there's a lot more than goes into headaches. It was so easy just to identify the type because when it comes to management of the headache, I think my colleagues will agree, it's such a multidisciplinary approach because a lot of times there could be an underlying issue as well, like mental health issues, something very simple as anxiety, depression, if we take, or even maybe uncontrolled high blood pressure. At times, those simple things also contribute to the headache. So I think algorithms, artificial intelligence, I always believe, will always be a tool, but can never take off. And I also believe that they cannot be a replacement for the clinical examination and history of a patient. The doctor-patient bond and relationship is so important. And I think that's why people, because what makes me scared for the younger generation, I'll be honest, Dr. Shankar, is that if they are not going to do a clinical exam, if they're not going to do a proper history, which we see sometimes now, that the history-taking skills are not as strong as they used to be when we were younger. You cannot, you cannot treat that patient. End of the day, we're dealing with life. So always we have to use, I think, artificial intelligence will always be a tool, but it can never replace our own thinking power and our evaluation because it's not generalized medicine. In actual reality, it's always personalized medicine. I think every patient we see, it's a personalized approach.
No, I completely agree with you because you cannot leave everything to a machine and probably you need. Yeah. I think ultimately artificial intelligence is being used to supplement or help the diagnosis to the doctors. But there is also a small problem that, as you say, people forget clinical examination and probably leave everything to a machine, saying that, yes, you have built an algorithm, so just put it through and we will see what is the result. That might happen, but probably that's a very dangerous trend of AI. Now, when some patient comes to you with a headache, at what point of time will you suspect brain tumor?
So there's certain features in the headache. So again, it comes down to the clinical history. When somebody comes with a headache and they start describing, that, okay, I'm having blurry vision with it. When I cough. So again, let's put it this way, our skull, it's a box. So now actually brain is a painless organ. There isn't any, so it is different entities that actually causes pain. So one part is increasing pressure in it. So if somebody comes in, they say, I'm having blurry vision, I'm having uncontrolled vomiting. When I get up in the morning, early morning headaches or night headaches, that could be a clue, because when they're lying down, change in position, that is causing an increase in headaches, which is due to the change in intracranial pressure. So these kind of symptoms can give us a clue that can this be something more than just a regular headache? And let's get an MRI done. Another important thing for our viewers to know is, let's say somebody is a person who has headaches. They regularly have migraines. Now, how will they identify? So that's why they have to pay close attention to what the usual headaches are and how is this headache different. What we also see many a times is sometimes this purely headache alone is not there. When you go into the clinical history, there might be subtle symptoms or features, that you see along with it, depending on the location of what is there. Like, for example, there was a mention, if it's a pituitary gland tumor, they might have a headache, they might have blurry vision, and they might have hormonal changes, which can give us a clue as well. So it all comes down, to exactly taking the history and asking important questions of blurry vision, change in position, early morning headaches, which can give us a clue.
Thank you. I'll now go on to Dr. Soumya Mittal. Dr. Mittal, my first question to you is, what is the number one neurological disorder that you have come across in your practice?
I beg your pardon?
What is the number one neurological disorder that you have come across in your practice?
See, headache is one of the most common symptoms we have when the person comes to us. That is one of the most common presenting symptom in any OPD. I believe, I think 60 to 70% patients minimum on a given day, if not 100%, are coming to us with a headache. That is one of the most common symptoms we have. Now, it can be a very simple headache, or it can be something which is just, starting to develop. Sometimes, it starts like a migraine. A headache will start like a migraine. A person will just come, headache hota hai, ek side hota hai, ulti hoti hai. And, one tends to think, there's no other symptom. Yes, a person might just have a simple migraine. When it evolves, then we find out, yes, the patient has having something more. We have to have a proper close follow-up of the patient. And that is when sometimes these things, they pick up on a later time. And that is why sometimes they always have a late onset or late detection sometimes because of that, when a person does not have a close follow-up. A close follow-up is very, very necessary for a person's detection of these symptoms. Most of the times what happens is that our patients come to us very late. They always have some form of treatment somewhere taken by, anywhere on their own. And when they come back to us, it's already quite progressed. So yes, headache being the first symptom and one of the most common symptoms for brain tumors is a very significant symptom there.
Yeah. How common is brain tumor in children?
In children, I have not come across too many patients, but yes, definitely it is it can happen in children also. It's not like they do not have children. In fact, up to the age of 15 years, they have a higher propensity to have a tumor. Most of the common age group where the less of age group which the tumor frequency is less is 15 to 25. And thereafter, again, slowly the frequency of tumors rises. So yes, but before 15 also they can have tumors.
And what exactly is movement disorder and how is it treated?
See, movement disorder is another thing. Movement disorder is where one has a difference in the movement of the muscles. We have two forms of muscles in every part. One is to do one part and the other is to control the other part. Now, if there's a mismatch, it can cause a movement disorder, which can happen like a tremor, can happen like a chorea. And most of this is controlled by the brain. So if we have a tumor sitting somewhere around the areas which control those things, those coordination parts, then yes, we can have a movement disorder. We can have a tremor. We can have a chorea, person presenting with that. But most commonly the headache symptoms, the nausea, vomiting, those are the predominant symptoms which the patient can present with.
Now, a year back, Australian researchers created what is called a hydrogel that can be used to better treat Parkinson's disease and possibly other neurological disorders. The hydrogel works by delivering cells and proteins to the brain to restore tissues that has been damaged by Parkinson's. So what is the current development on this?
I don't think we have this in India as of now.
No, it's not in India.
And this is still, as far as I know, even in Australia, it is still a research tool. I don't think even they are using it much as a clinical tool so far.
Fine. I'll just come with one more round of questions to a few. Dr. Amy, Dr. Gupta was one thing that we read quite some time back was in research form. We had light-induced, format and sound-induced format to blast the brain. That is, you seed the brain with certain chemicals, and then you have a light flashing or a sound flashing, and then you break the tumor. Has this taken off actually?
No, I don't think. Again, it's something which is as a research. There are multiple facets which you use. So the latest which we are trying to use, as I told you, is the focus ultrasound. And the focus ultrasound is a tool where it's just like an ultrasound, which is, as you know, it's an ultrasound waves which you use to diagnose. When you use ultrasound for diagnosis, the same waves are being used to treat the patient by creating a kind of a heat inside a particular area in brain. So that is the mechanism of focus ultrasound. I was fortunate enough, I was in the University of Virginia, I worked there for a year, and was fortunate enough, that is the university where this was kind of a pioneer work was done in ultrasound. And on this basis only, the FDA approval was given for the use of focus ultrasound in treating brain. And brain especially for, as you just told, for movement disorders, where you're talking about tremors. It's not even being used in Parkinson's. Predominantly, it is being used in essential tremors. But there, the research is being done to treat the brain tumors. Unfortunately, the skull which is there and present over the covering over the brain is a hindrance to ultrasound. So what we are trying to do is surgically remove the part of that particular skull where the ultrasound can penetrate, and replace it with a material which is more transparent to the ultrasound waves, and then you can treat that particular brain tumor. So these are the advances which are going on. Continuous research is being done and different avenues are there. So I think if something which is used as a therapeutic, as you were talking about Australia hydrogel, that would be available to most of the world. Everybody would like to have it. But unfortunately, these are all still under research, and they have not been given the clinical trial or approval for use of clinical use.
Yes, they're still in animal model research. They're not just yet moved forward to that. But then quite an exciting area of research, I think.
Very true.
Dr. Sonia, what exactly is the research that excites you so far as headaches are concerned? Of course, we all should not get headache, but what is exactly that excites you regarding headache research?
Help me find something that will cure the headache. There is no cure. The first question every patient wants to know is, "Ye headache chale jayega na? Ye bilkul theek ho jayega?" And our answer always is, we can control it, we can manage it, but we cannot completely, remove it or cure it. So I think in neurology in general, there are so many things, but that where we wish we could just have the treatment where we can actually get that satisfaction of curing it. So I think if at the day we can find a way to, just say, okay, you take this and the headache is gone and you're absolutely fine. I think that would be the day. I think that I would be very happy at that on that day.
I think only a magic wand can do that. That is far away.
Absolutely. But otherwise, there's a lot of research going on in terms of, I think, different medications, and CGRP antagonist, a particular type of medication for migraines. I'm waiting that once it comes to India, I think Dr. Soumya will also, I think, agree with me that we're waiting that it comes to India, we can offer that to our patient, because the data coming out for that is overall good, and we are seeing good results. And my colleagues who are using it in the US and other countries, they're seeing good results with it as well. So we're just waiting that, let it come to India. Let's give an option, where we can at least help our patients out in some way when nothing else is working.
Well, Dr. Soumya, you want to add anything to that?
Any research to end headache is good. Being a migrainea myself, I can definitely, feel it. It's a bad thing to have.
Yeah, I think we are all fortunate that we are not having much of headache, except that when we have some heavy pressure of work, we say, yes, it is a headache. Or we meet someone whom we don't like, we say, yes, he's a headache. Otherwise, we don't think that we have that headache. But then, as all of you have said, headache is of course, a major problem. Brain tumor is a major problem. Thank you very much, my wonderful panelists, having you all with us, and such a wonderful session on a wonderful organ, which is still a mystery. I think that's exactly how the brain is. And one day, probably, we have insights into various planets, into solar systems, into black holes, into this and that. But the human brain still continues to be a very, very mysterious organ. I think that is something that is created by someone who we don't know. Thank you very much.
Thank you so much.
Thank you so much.
Over to you, Kishore.
थैंक यू सर। तो आज के एपिसोड में इतना ही। शो में शामिल सभी डॉक्टरों और एक्सपर्ट्स का शुक्रिया अदा करते हुए हम इजाजत चाहेंगे। जाने से पहले हम आपको बता दें कि अगले रविवार यानी 19 जून को हम हेल्थ फॉर ऑल में चर्चा करेंगे दुर्लभ बीमारियों पर, रेयर डिजीजेस, डायग्नोसिस एंड मैनेजमेंट। रविवार सुबह 8 बजे, नोट कर लीजिए। नमस्कार, टेक केयर।